The ward that this has happened at is subject to the largest maternity investigation in NHS history. There's 2,500 other cases of baby death, baby brain damage, serious harm, mother death, mother serious harm. I'm seeing signs, we love the NHS. I'm like, he fucking killed my daughter and covered it up. If people believe me, I would get justice for my daughter. Children are born healthy, nothing wrong with them. What happened next, which is that both of them started bleeding from the lungs. They weren't bleeding from the lungs when they were born. And they're saying to us, no, it's because they're premature. Now red flags going off because I'm like, are the other babies on the ward bleeding from the lungs? They're like, no.
Yeah, it's a lot already, right?
Yeah. I'm scared of them because of the lies that they keep telling. From everything I tell you from now to the end, it's recorded.
This is serious.
We have to entrust our children to people that are abusing us and lying about it, right? When some of these events eventually went to court, what they did was they started deleting parts of the notes that prove what I'm saying is true. So they'll say something, they'll make an allegation like,
this is getting worse and worse and worse the more you speak.
It gets worse.
I'm really sorry this happened for you.
2 days later, my daughter dies. They're saying this event is going to be investigated, don't worry. I've later found out, investigation shut down. She just given me my daughter's dead body and just gone.
This show is a Podfirst production. Podfirst specialise in cinematic, high-quality video media production and podcasts, including projects such as viral social media content for business owners and entrepreneurs, internal communications for organisations, and charity incentives like Homeless FC. Managing and directing the project from start to finish. So whether it's pre and post-production, branding, guest selection and booking, set design, social media strategy, marketing and management, the list continues. Whether you're a business owner or an organisation, Podfirst is here to help you to achieve your objectives and your vision. If any of this sounds like you, then you can visit Podfirst at www.podfirst.com. That's www.podfirst.com. Ama Maduako.
Ama Maduako.
Welcome to the heart of it.
Thank you.
That's quite a name. Where's it come from?
I'm Igbo, so that's Igbos are mainly from Nigeria, but we're everywhere, to be fair.
You're Igbo?
Igbo, yeah, that's like my ethnicity, but Nigerian basically, yeah.
Interesting.
Yeah.
Were you born in the UK?
Born and raised in the UK, yeah.
But mum and dad were from Nigeria?
Yeah, my mum is from, my mum was born in the UK, but she's Igbo. My dad was born in Nigeria and he's Igbo, so yeah.
Is there different Igbos equivalent to an Igbo but still from Nigeria?
I think, any group of people, you can get more down to like specifics, but...
Now, what would the equivalent be of like English? Like if I'm born...
it would be like someone's English, but this person's like a Londoner or a Geordie or something.
Yeah. So you were born in the UK?
Yes.
Where were you born?
So I was born in London. I'm from Islington, London, which is just North London, quintessential North London. Went school North London, like I actually went to like quite a decent school, but it's in like Edmonton, which is not the best area, but it's quite a good school in that area. So pretty much born and raised North London most of my life. Yeah.
What brought you up to Nottingham then?
So I went uni in Leicester. After I went to uni, I kind of wanted to change. I'd been to Nottingham a few times and I thought it's not bad here. And even to this day, I still do like Nottingham. I think it's a decent city. After uni in Leicester, I was like, I want to change, I want some independence. So I moved to West Bridgeford, actually, in Nottingham, which people think is like a posh area, but I was in like a new build, so I wasn't in like a posh house or nothing. But I was in West Bridgeford, which is a decent area in Nottingham, yeah.
The best area, some say.
Some say, but it depends what you're into, isn't it? Like,
I live there, so I say it's good.
You think it's good?
Yeah.
Okay, nice.
I mean, I live on one of the nice roads, so yeah, I will say that.
Fair enough.
So Leicester University.
Yeah.
What did you do at university?
I studied chemistry. But it's funny because I didn't really even want to go uni. My mum kind of like made me go uni more. I think it was probably a good thing because my mum like pushes me like educationally. But at first I didn't want to go uni. I ended up going uni. I think I took like an extra year to finish or something like that because I was just mucking around. I managed to graduate. I've got like 2-1 in chemistry. So yeah, some would say that's all right, isn't it?
So kind of good upbringing, good school in London, went to university, mucked around a bit, but you're clearly educated. Got 2-1. Moved to Nottingham, into West Bridgeford, into a new build.
Yeah.
And then sort of what led you from being in a West Bridgeford new build, doing well for yourself, really, academically.
I was doing all right, yeah.
Then what happened from that moment to how we're sat here today talking?
Right, so obviously I've got a girl. My girl at the time, we was living in the same place in West Bridgeford. Everything was going perfect. We didn't plan to have kids. You know how it goes. She's ended up getting pregnant.
Tell us more.
I want to go and do that. No, so she's obviously she's got pregnant, and me being like kind of immature, I was thinking, oh fuck's sake. But now I'm like, oh my god, like I love kids. But I was like, oh no, like. But then obviously we thought at first when she got pregnant, we thought she had a miscarriage, unfortunately. So we was thinking, oh no, like we just got used to the idea of it, and then we thought she had a miscarriage. So then she's then gone in for a scan, and she's like, I've not had a miscarriage, I'm actually pregnant with twins. So I'm sort of like, what the fuck? Like,
so you've gone from young, we're pregnant, like shit, are we ready for this?
Yeah.
Then you thought, shit, we lost it.
Yeah.
Then you think, shit, know what to do.
Yeah, yeah.
And what's the space of this like?
This is like, oh God, I think it's like over like an 8-week period. There's some woman's gonna throw this I think it's like 8 weeks or something, like span of time frame.
No baby to baby to no baby to 2 babies.
Twins, yeah. And then that's when I was sort of like really getting into it and used to it, because I was like thinking like, yeah, like I want this, you know what I mean? I'm happy with this. And I always tell this story now, but when we found out we was having twins, before we did the gender scan, I've actually pointed at the babies in a womb, and I've gone, that's the boy. I said, I reckon that's a boy, that's a girl. And then I've named them. So I've named them before we've even done the gender scan, right? And then when we went in for the gender scan, they've said to us, no, it's a boy and a boy. And I'm like, are you sure? And they're like, yep, 100%, that's a boy, that's a boy. And I'm just like,
it's a turtle or a burger, right? That's how they identify on the gender scan.
Oh, is it? Oh,
yeah, so if it looks like a little burger, it's a girl. If it looks like a little turtle.
I don't know. She must have seen a fucking French fry or something. I don't know what she saw, because like they've said that it's 2 boys, but it wasn't in the end.
So was this NHS gender scan at this 20-week?
So we was doing full NHS, and this is going to sound really bad, but I was kind of saying to her like, I don't like this. I don't like this. Because when we were even going to the hospital, like I felt like they was really rude, but it was like a not that big a deal thing, but it was like, like.
So walk me through this, because we found out, how old were you at the time?
I was 24, I think. 24, yeah. Or 25.
24, 25 years old.
Yeah.
Find out you're pregnant. How did you find out she was pregnant? So did she come and tell you,
yeah,
I've done a test?
Yeah.
Found she's pregnant because she told you to do a test. You were initially mixed signal or mixed messages from you, or mixed emotions from you.
Yeah.
How you felt. Then you've obviously found out potentially she miscarried. Then you found out she hadn't miscarried.
Yeah.
So this is what, the 8 weeks point, 12 weeks
somewhere around, somewhere around that, between that and the gender.
Then you've then gone to a 20-week NHS gender scan.
Is it 20 weeks, something like that?
Yeah, because we had 8-week private scan straight away.
Okay.
Then we had the 12-week NHS one. Then we had a 16-week private gender scan.
Right.
And then we had the 20-week NHS scan. Then we had a 4D scan before the baby came.
Okay.
Obviously got carried away like baby fever. So I'm imagining, if that's correct still, you'd have the 20-week NHS scan.
Somewhere around that. It might be.
To get the gender.
Yeah.
And so you were told 2 boys.
We were told that with certainty, and just what I was saying about like the kind of rudeness and stuff, you know, like this is like it's 2022, so it's around just after like COVID time kind of thing. But like, I don't know if this happened to you, but when you go in, they're sort of like, no, like you have to stay outside. They'll tell you like the dad has to stay outside and the mum can come in. So I was sort of thinking already, I don't know if that happened to you, but I was sort of thinking like, I don't like that, because we're in this together. And they were telling us like, you've got to wait out here in the room until we've let you in. So I was kind of just like, okay. And
Is that to do with COVID?
That's what they were saying. They were like, oh, because of the COVID rules. But I honestly, and I'm just going to be candid, I felt like it's a bit sexist, because I think, and we'll get into this a bit more, but I feel like sometimes the way they treat fathers on these wards, they kind of treat you like, oh, you're just a dad. Like, and I know it's meant to be patient-centered, where the mother is more of the inpatient kind of care, but they're quite dismissive sometimes with fathers. So
And just to be, again, maybe it's nothing to do with it. I'm not trying to bring this card onto the table.
Yeah.
But obviously you're black and I'm white.
Yeah.
And you've obviously probably had a massively different experience of your life living in the UK than I have, being from England and white.
It's different. I always thought it was different in a good way, where like growing up in London, everyone's, do you know what I mean? We just all get on with it, do you know what I mean? And I've only come to realize recently that there's a difference between being a black kid to a black teenager to a black man. Because and that's the same if you're any race, but when you become a man, you are perceived as more able to, you're more likely to be perceived as aggressive, or like if a police officer comes in and sees me and like a little kind of like, let's just say a girl from another race, they might think, oh, this guy, I'm more likely to be able to do harm. And this is not just me saying, this is backed up by like, you can look into like the Doolittle model, which is a part of the policing model that they use, where they designate people as someone's the alpha aggressor. That's usually going to be the man. So there's a way that they will perceive you, whatever race you are, as a grown man that's different to when you're a young boy. So yeah, like I did feel like they're kind of dismissive, and they, but yeah, your experience in healthcare will probably be different based on if you've got disability, if you've got mental health, if you're black, white, yellow, whatever. Even classes as well.
Do you think that's to do with the staff member who is dealing with you, the nurse potentially in this case, or institutional? Because the police force have obviously been always accused of being institutionally racist, certainly Metropolitan Police. And so is it the person who's working there who was like that, or was it, do you think, a massive systemic issue across the healthcare system?
I think everybody has biases and prejudices. All of us do. But when you go into a heightened environment, it's more subtle and it can have more of a big impact. It's sort of like, I'm assuming, got no issue with anyone, right? If you went to prison in LA or something, it's like a fight or flight place. So you might think, right, I've got to hang around with people that's like me. So you might not want to be like, but it's a subconscious thing. Whenever you're in an environment where it's like fight or flight, or it's more tense, or it's more emotionally charged, or people might die, like that's when small things might play out in a bigger way, I think. Yeah. So I don't know if they do it on purpose. I think it's just small biases.
Your subconscious bias plays out.
Subconscious biases, yeah.
Yeah, because I guess that woman, for example, who'd asked you to stay out, the nurse, she's at a normal day at work, whereas you're going for a 20-week baby scan, your first child. Yeah. Like one of the most significant moments of your life.
Right.
And the impact of her saying, wait, out there was huge for you. And I guess even if it was COVID rules and there was a real health reason to do so, I imagine you felt like you wanted to handle it in a way of like, please respect the fact this is a big deal for me. And you're not only asking me to stand outside, whether for the rules you've been told, but you're not even compassionate to say, hey, I know you got to stand outside, this is shit, but it's what we got to do.
But the thing is, it's not even just me or black males, whatever, that's experiencing this. If you look in the news, everyone's complaining about this, about how the NHS is, how they treat people. And, some people say they have great experience, that's great. But it is becoming more prevalent in the news cycle where people are saying, right, a lot of these trusts are failing, people feel like not being listened to, people are waiting a long time for treatment and stuff. So it's not just affecting me, mate, it's affecting all of us in the UK that are dealing with the health system, these kind of things. Yeah.
So you went in for the baby scan, the gender scan, or eventually you got let in.
Yeah.
Told it was 2 boys.
Yeah.
Play out then the next, you said it wasn't. So how do we learn it wasn't?
So obviously, fast forward a bit, we've ended up, my girls ended up going into premature labor. This is at 25 weeks, so very early.
Wow.
Obviously that is when I'd say that the kind of nightmare began, because you've gone from just having a normal day, and then once that premature labor starts, you've then gone from premature labor, you're in the hospital, now you're in the neonatal ward, to now your kids are on the ward, born, or eventually, which I'll get into, but your kids on the ward, and then you've now got to focus everything in your life onto that because you've now got kids. So it's very like quick from what's going on, I'm just having a normal day, to now you're in the situation where your kid's on the ward. So yeah, we when she went into premature labor, she was bleeding overnight. She was telling me like, this ain't normal, and I was saying like, look, because I had work in the morning, I had to wake up at 6:30 and it was like 2 a.m. and I'm saying like, are you sure? Because this is fucked. I've just started this new job. I'm like, are you sure?
Lots of men. I was going to laugh. So when my daughter was born 9 years ago, so the Shaw comment, it's like, mooing across the bed. And I'm like, are you sure? Like, you just wet the bed. Like, are you sure? Because most men were like, we don't obviously have any indication, no experience of knowing what normally would happen in my body.
Yeah.
Are you sure? Are you definitely sure? It's exactly what you just reported.
Yeah. And she wasn't giving birth, but something was wrong because she was bleeding. So obviously, I've actually gone to work in the morning because I was saying, are you sure? And then she was kind of saying, no, it's not. And then, yes, it's not. So then I think around in the morning, I woke up to go to work. She was saying, I've got to go to the hospital. And I was saying, mate, please don't tell me this. Because obviously I'm knowing like 25 weeks, this ain't normal. She's like, and I think that day she already had a hospital appointment booked. So she was like, right, I'm just going to go in for my hospital appointment. So I'm like, cool, call me if you need anything. So I've gone to work, which I reckon now looking back, I probably should have not gone to work that day. But I didn't think she was in labour.
What was going through your mind? Like when a woman starts to bleed, probably pregnancy changes it probably in your mind a little bit, but women bleed. Yeah, but it's not normal to just be bleeding at 25. But obviously I don't know, like I'm not like an expert on this stuff, but it's just kind of like stop bleeding. So I'm thinking like, is it going to be all right? Is it not going to be all right? Like heavy bleeding, like it's significant.
I wouldn't say heavy, just abnormal, just constant.
It's not her period. She knows it's not her period. It's not that kind of blood.
No, because she's like
obviously she's pregnant, but in terms of the flow style, like she was like, this is.
I can't really go into detail, but I don't know.
But in terms of like what she was telling you, like she was telling you, I'm bleeding, I'm worried.
Like, this needs to be addressed, and I'm sort of like, because I know that 25 weeks, this is bad if this is the bad. But it ended up as a compromise because she had an appointment that day anyway. So she's just saying, like, I'm going to go in for my appointment, right? And then we're going to see what's going on. When she's gone in for her appointment, I'm at work, probably like 9:30 now or 10:30, something like that. I've got a call, listen, I'm going into labour. And I'm like, oh my fucking God, mate. Like, so then I've told the manager at work, I'm like, listen, mate, and my manager's a really decent guy. I was like, mate, I've got to go. He's like, fucking go, right? So I've got to the hospital. And then I've like called my family, Sean was in labour, etc., etc. Obviously, we've been there, and then they started saying to us like, because she's in advanced, like she's starting to go into like more advanced stage of labour. Because we went to QMC first, then we went to Nottingham City Hospital because I think they said they don't have beds for twins or something like that. Because they weren't born yet. I think they wanted them to be at Nottingham City.
So she went for an appointment. Where was the appointment? QMC.
I think the appointment was at QMC,
And then she went into labour at QMC?
No, well, they examined her and they were like, you're dilated, you're going to be in labour soon, you need to go. So then we all went to Nottingham City.
We all went as in you physically went separately, or she was taken with ambulance or transport?
Actually, I think she went and then I met her at QMC and then I think she went in the ambulance and I drove behind. I can't remember the exact. It was something like that. They
admitted her, right? They admitted her onto the hospital.
Yeah.
And then they dealt with her from then on, taking her to the next hospital.
Yeah. So she's obviously now an inpatient because they're like, she's in labour, etc. And then they were saying to us like, oh, you need to take these things called antenatal steroids and magnesium sulfate, which are, they help to give like a protective effect to the baby. And also that they, one of them I think come somewhat delayed the onset of labour a little bit. So they're saying like, oh, take this. And then she's like, wait, I want to read information about it. So I think we got to Nottingham City, they're like, take these drugs. And then, but they were saying like, you're not going to get the full course because you're too in labour, but you're not going to get the full course of this. Take this. And then they're saying to me, oh, do you want to tell her to take it? And I said these exact words, which I don't know why they've lied so much, but unbelievable amounts these people lie. But I've specifically said, it's not my body, so I can't make the decision because they're saying that she should take these things for the baby. She's saying that they've told her she can't take the full course. And I've read up on what the thing is, like the antenatal steroids, and I'm like, I'm neutral, I don't know. And I'm like, it's not me, I don't want to make a decision about something I don't know short term. And she's saying the same thing. And they're just like, listen, it's not that big deal, but we want you to take this, but you're not going to get the full course anyway.
And this is a doctor, surgeon,
this
midwife?
Is like the nurses are saying like, yeah, you want to take this. So she decides that she's not going to take it. And it's not even a big deal really, because I've looked into the stats and apparently in premature births, like 30% of patients don't get the antenatal steroids. They've actually...
When it's as in early
When it's a premature birth, yeah.
So is there some sort of criteria that's if it's a certain amount of weeks early?
Realistic. I mean, looking back, knowing what I know now, probably she should have taken them in a sense of like that scientific, the data suggests that that's a good thing to do. But at the same time, she's specifically being told you're not going to get the full course. And also, it's not uncommon for people to not take it. But they've made out like, this is crazy, this is insane, how can you? But at the time, it was just like normal birthing decisions of a mother.
Well, so you 38 weeks, right, is when you normally give birth?
Yes.
But we're now 25 weeks, so we're significantly early.
Yes.
But she was already in labour.
Yes, exactly.
So the tablet, like a tablet course, was it tablets or
antenatal steroids? I think is an inject. Oh, I don't want to butcher this. I think it's an injection.
So they were offering to give a medication, however administered, medication
but she's in active labour.
But she's in like how would that protect the baby if the baby's coming now?
Well, again, I've looked into the data on it. The effect is very minimal in a position like that, because obviously they're already in labour and the birth is
imminent.
So they're already in labour. And you can't really, at that point, you couldn't have delayed the birth. But remember, these nurses, everything they do is based on policy. This is what the policy says. It says this on the piece of paper. Do you get what I'm saying? Mm-hmm. In reality, it wouldn't have made a difference. And the staff have actually told us it made no difference. So that's a key point, is they've said to us, makes no difference, right? Afterwards, because my girl was sort of saying, oh, should I have taken it? And the doctor was saying, listen, it doesn't make a difference. Don't worry. He was already in labour. We're here now. It's fine. So she didn't take the antenatal steroids. Birth takes place. Children are born healthy. Nothing wrong with them. Good condition.
Natural birth.
Loud cry. Natural birth. When she was in labour, they were saying, oh, you have to take these drugs to pass the placenta. And she was saying, I'm fine. And then they were saying, oh, you have to take these drugs or you're going to bleed out. She's saying, I'm fine. So they're not listening to her already. You understand? So
let's walk you through, right? So we get moved to City Hospital. Then there's conversations with nurses, midwives immediately saying, take this medication.
Yeah.
Trying to get you to help her to take it. And again, they're just following policy, like you said.
Yeah.
Computer says, 25 weeks, take this. It's better.
Yeah.
Doesn't decide to take it for whatever reason. Her body, her mind.
Yeah.
Babies come. How long after you guys got to City Hospital did the babies come?
Oh, I think it was quite soon, actually. I want to say maybe like 2 to 3 hours again.
So quick, right? In the morning, the middle of the night, she's reporting bleeding.
Yeah.
Goes to her appointment sort of 9:30.
GMC, yeah.
You get a call 9:30 work saying, I'm in labour. That's at QMC. She's then moved from QMC to City Hospital at sort of 10, 11, 12-ish.
Yeah.
And baby's coming like now.
Actually, no, I want to say it's a bit longer. Maybe like, I think she was at QMC for longer, because when I got to QMC, I think I did get to QMC and then we was there for a few hours. And then I think, it was the same day, I think. So yeah, maybe a few hours after.
So potentially like 12, 1.
I think the babies were born, I should know this, maybe like 6, 7 p.m, something like that, maybe.
So it was still like same day though, right? Got there, she must have had an appointment at 9, 10 past 9.
Yeah.
Scanned, problem, admitted to hospital and labour. And then throughout that day, it's obviously, you're dilated,
we're
going to City Hospital, you turn up at QMC, move to City Hospital, medication questions, baby's born 6, 7 p.m. that day.
Something like
City
that.
Hospital.
Yeah, the exact times.
But framing wise, we're kind of along that.
Yes, definitely.
Babies are born healthy.
Babies born healthy, nothing wrong.
2 boys, one after another.
No, boy and a girl, right?
So you've had a boys come out. They passed you the boy?
The girl came out first.
The girl came out first. You were like, that's not a boy.
And I'm like, what the fuck? And I'm like, almost fainting.
So that's the first, not the first alarm bell that day, but that's definitely not a boy.
Exactly. And then you got to remember as well what I told you before. That's a girl, that's a boy in the womb. I was right. So I've named them before I've even done the gender scan. They've told us it's a boy and I'm fucking right. So I'm like, what the fuck? Because imagine like, you thinking you're going to get 2 boys. Not only do you get a girl and a boy, they're in the thing that what's that, like a 1 in 4 chance? I don't know what the chance is, but it's still interesting to be like, I'm fucking right, the hospital was wrong. They've done the scan and I've named them before I've even known what they are. It's insane. So obviously I'm there like, what the fuck? This is a wild 2 days. I've just had I've gone from like, now if you really think about it, you've gone from thought you having a miscarriage, twins, thought the twins was a girl and a boy, so pretend it's a boy and a boy. Twins come out as a girl and a boy, like. Yeah.
So girls passed you, you're like, that's not a boy.
They didn't even pass them to us because we wasn't even allowed to really hold. I think mum
So she's delivered naturally, obviously cord attached, but 25 weeks, these babies are little, right?
They're very little, yeah.
So they've almost probably taken them straight off to
pretty much
immediately
the neonatal ward.
put
So
them
both
into...
of them have gone to neonatal, and I think my daughter went off first, so I'm like running between like neonatal and maternity.
What was the gap between the two births?
Pretty short. It was like 30 minutes or something like that.
She's given birth to a girl, but you thought it was a boy. They've rushed her straight off to neonatal.
Yeah.
And then
not even 30 actually. It might have been like 15 minutes, yeah.
So you're like, baby's gone.
Yeah.
Coming back because mum's still giving birth to the second baby. Are you thinking this could be a girl as well?
No. I don't know. I wasn't actually thinking about whether it'd be a boy and a girl because I was already starting in shock about the girl. And I don't think it was that soon after that my son came. So yeah, girl and a boy, it's ended up being girls come out first, which is Adora, and then boys come out, which is Zikora. So Adora and Zeke is what we call it. Mm-hmm. And then, so then I've gone to the neonatal ward, and while I'm on the neonatal ward, I'm talking to this doctor, really nice guy. And he said to me, are you okay for them to be put on the ventilator? So I'm thinking like, mate, I don't fucking know what's going on. So I'm saying like, wait, like, can you tell me what's going on? Is there any other options? And he says to me, there's no time to explain. Are you okay with me to put on the ventilator? And I said, no, I want you to explain what's going on. He said, mate, I'm telling you, there's no time to explain. So I've gone, fair enough. Because obviously, if your doctor's telling you there's no time, cool. But at first, I wanted an explanation. But when he's told me there's no time to explain, I'm like, cool.
So let's go that walk through, because I think, obviously I'm sure, I obviously don't know the story yet fully, but some people would think, I think there's probably a range of people who think a range of different stuff because everyone's got these different opinions when it comes to anything. Everyone's got a different opinion, but babies, whether you get cot bumpers, don't get cot bumpers, do this, do that, everyone's got a different opinion.
Yeah.
But you've obviously woken up in the morning to go to work thinking there's some issue in the night, but hopefully it's not a big one. Mm-hmm. She's gone into labour at the appointment, and then you've now in hospital, and it's now 7 o'clock at night. So like a 12-hour period's gone on. You've now got a girl come out who was told is a boy.
Yeah.
And then a boy come out. Obviously 25 weeks, we're now very premature. And a doctor's saying to you, are you okay? And you've had the medication.
Yeah. And during the birth, the things, so when they were saying to her, like, take this or the placenta's not going to come out. Trust me, well, I'm 100% certain placenta comes out 5 seconds later. Take this or you're going to bleed out. Bleeding stops 5 minutes later. So she's had like almost like a remarkably easy birth. And everything they've said so far has been wrong. They've been wrong about the gender. They've been wrong about whether she needed to take this to plus placenta. They've been wrong about the bleeding. So and then when the experience we had before, when they're kind of being off about letting us come in the room, all I'm seeing from my perspective is they keep being wrong and they keep being dismissive. But yeah, obviously after they've said that they have to go on the ventilator, it's not my decision, is it? I'm not a doctor, innit? So they've gone on the ventilator. Both of them have been put on the ventilator, and there's different types of ventilators. So they got put on the tube, the mechanical ventilator. So what the thing I wanted the doctor to explain is, are there other types of ventilator that can be put on?
Well, first of all, the reason I'm asking is because I've got, when you say ventilator, I'm imagining casualty, and they're in a little box. Because I came out premature, and I was in hospital for since most of the 5 years of my beginning of my life, because I've got different things went on. So I was super small, didn't develop properly, and I remember being told I was on a ventilator. And what I thought a ventilator is, when you just said it, is in one of those, like a camp, things they put hamstring, like a big plastic thing,
like an incubator. Yeah, they were in an incubator. Yeah,
so they weren't pipes or anything.
Yeah, they had like a
that's
tube
what they're saying is the ventilator.
That's the ventilator. Yeah.
So what's the incubation?
The incubator is like the bed that they're in, and then the intubation is the tubes that goes.
Is there lights and stuff for the jaundice?
Yeah, there's. They do those like periodically, so they put the lights on. But yeah, so I'm seeing this little. I don't know if the camera, because it's sort of like
tiny little baby.
This big, like just bigger than my hand, really, like that big. Baby
the baby's your hand.
Too, yeah, pretty much. Like this is 25 weeks.
That is small.
They're literally tiny, and I've got big hands, so.
So when you asked about the ventilator, you said there's no time.
Yeah.
Well, obviously you just sort of said what you thought in the moment. What do you now know about ventilation? Because
good.
I know nothing about ventilation. So I would assume ventilation, as in breathing, for a baby who's not developed yet, would be a good thing to help.
Yes, it is a good thing. What I now know, so there's a lot of work being done about what the best method is to use for babies that are premature, like this early premature. They're still doing work on it. Because the reality is that the mechanical intubation, the tube, and doctors sometimes, they won't admit this, but this is the truth. Those tubes can cause damage. A lot of people during COVID damaged with the ventilation tubes. They can cause damage. What they're trying to do is balance the damage with the potential life-saving support that the ventilator provides. What I now know is that, because at the time, he explained to me later that they have to, there's something that they administer, which is called surfactant. And he said to me that they need to be on the ventilator in order to get the surfactant administered. But it's now come out, and this has probably been technology for a while, that there's something called LISA. I think it's lesser invasive surfactant administration. So there is actually ways to administer the surfactant without putting them on the ventilator. Also, there are children that when they're born, they can be put onto the CPAP, the mask, which is just pressure without the tube, pressure and air without the tube, or high flow nasal cannula oxygen. So there's levels. It goes ventilator with the mechanical intubation, then it goes CPAP and high flow are like here and here. Then it goes nasal cannula, which is just oxygen. A baby can experience any of those. So when I'm asking, I'm not saying don't give him support. I'm saying I kind of want to know what level we're at of support, but he's saying there's no time. We have to put him on the mechanical ventilator.
And is the mechanical ventilator the top one?
That's the most invasive one.
Most invasive, but most impact is in support?
Yes, because the reality is that is more high risk than the other procedure. And CPAP can be high risk too, but it's more high risk. So, but then at the same time, it can also be life-saving. The thing that is confusing me is that they were breathing at birth, they were fine, they were in good condition. And I've asked them numerous times in the subsequent to this, was the decision to intubate based on their condition or based on policy? And they keep flip-flopping and changing. Because it matters to me. If it's their condition, then you've done an observation. If it's policy, then you've done it just because it says so in the book, right? But either way, they're going to do what they're going to do. Do you know what I mean?
It's tough, isn't it? I think we can get into that part because we can definitely discuss the pros and cons of which one they did and which one they should do.
Yeah.
But let's just keep to the story now before we've analysed the shit out of what they did and didn't do.
Yeah.
They offered you the ventilator, or they told you, well, asked for consent is what they're doing, right? Can we put them on the ventilator?
Yes.
You, because of pressure and because you want to save your children's life, you said yes.
Yeah, but the thing is, that's not a matter of my consent, because they consider that to be life-saving. And to be quite honest, I wouldn't even feel comfortable making the medical determination about what was the best decision at that point. I don't think that what they did was necessarily wrong to put them on the ventilator. It's only significant because of what happened next, which is that both of them started bleeding from the lungs. You understand? So now we're really questioning.
So let's go. So
was this the right decision?
Yeah, it's a lot already, right?
Yeah.
So we put them on the ventilator.
Yeah.
You did say yes to give consent, but they didn't need your consent because could it consider life-threatening, life intervention. So there was more of a courtesy. They said, can we put them on?
Yes.
But we're doing it anyway.
Yes.
So they made the decision, whether from policy or from assessment, to ventilate them and kind of run it past you, but really made the decision for you.
Yes. And nobody's saying that they did the wrong thing. They're trying to save the child's life, you understand? Right.
So, and if the babies were born at 6, 7 p.m, what kind of time would they put on the ventilator straight away?
Pretty much, yeah. It would be straight away.
And then what happened from there? How long was it from that before now we've just mentioned lungs?
I think it was the next day that they're basically, so I don't think it was straight away, but they pretty much the next day we knew for certain. They're like, yeah, the babies are bleeding from the lungs, like that. They may not survive. My son was bleeding worse. So then we're asking them like, are you sure this wasn't because of the ventilator? Because they weren't bleeding from the lungs when they were born. And they're saying to us, no, it's because they're premature. So obviously now red flags going off because I'm like, are the other babies on the ward bleeding from the lungs? They're like, no. So I'm like, so why are our babies bleeding from the lungs? So we're thinking like, okay, maybe they did the ventilation process wrong, right? And that's why they're bleeding from the lungs.
And just for clarification again, the ventilator is where a tube goes down the throat.
Yes.
Into then poking and potentially near the lungs to put air into the lungs.
To put air into the lungs.
So if the other babies aren't, you're sort of interfering or at least asking the question, which I think is reasonable.
Yeah.
But if the other babies are prenatal babies, premature babies, aren't bleeding, is this because we've poked them or prodded them or something's happened in the administration of the ventilation? Which seems a reasonable question. Certainly,
it's a very reasonable question, but then they start to be defensive, dismissive. You see, they have this thing, I think they call it like litigation culture, where they're so scared of any suggestion that they've done something wrong that they immediately put up their barriers, they put up their defenses, they'd be dismissive.
So if we just go, if we go back a second, they were so adamant of you staying out of the scan straight away for the sake of health. Right. And that you mentioned, I get it. The mum's the inpatient and it's patient centric.
Yeah.
But then when something's happened to the kids and they're sort of to struggle with their life, it's not patient centric anymore. It's protect yourself centric.
It protected us from.
Because it'd be reasonable to ask, what's happening?
But it's reasonable to us as normal people. But when you're in this culture in the NHS for so long, what becomes reasonable to them becomes NHS policy. They never view anything, in my opinion, for a lot of them, from the perspective of the patient. They only they take everything as if you're challenging them or as if you're accusing them. They're very defensive. They're very dismissive, and some of them are actually quite ignorant. Again, not all of them, but they're it's like you've got people who are on the ward, and I'm not trying to shame people, but if some of these people, they're like younger than me, they're like student nurses, they've never had children, they've probably, some of them have never even been in a situation like this, and you're asking them a question, and they don't know, so they're just sort of like, right, I don't know, just don't ask about it. Do you get it? They don't want to think about the stuff they don't know. They want to follow policy because that's what makes them feel comfortable. But remember, healthcare is supposed to be a dynamic, patient-centered thing. Once you start deviating away from the patient-centered care, now you're just following policy, and that can be dangerous in terms of proper interaction with the patient.
I hear you. This is obviously, super emotional for you because you went through this. This is not my emotional story. I'm just thinking about how. Was your opinion, let me ask you this question first, was your opinion of the NHS before you went through this? Or is this now because of what's happened and what you've experienced and obviously what proof you've got from your experience this happened? Because I think we can go around this a couple of ways. We can dive into the story and get the facts, and then we can start criticising or playing devil's advocate both sides.
Yeah.
If it's cool with you to do that, because I appreciate this is your children that went through this and you as a family, because I'm trying to find, as I'm hearing this, I'm trying to go, okay, where's the bit that if you were to look at what should be done differently?
Yeah.
First of all, we've got to establish what they did do, why they did it, and what the culture is. I think it's like third piece of our like discovery here.
Yes.
Because we've obviously discussed about an investigation here that's obviously still ongoing.
Yeah.
If we just establish what the facts are, doctor said this, they went on this, then they started to bleed, then we can go back through those facts once we've established them and then we can start discussing, okay, well, if those are the facts, what caused those facts to become true?
Yeah, well, I feel that I'm quite an open-minded person. I don't accuse people based on lack of evidence. The issues
but just to challenge that, you've obviously here with me talking, obviously you, as I say, you've got the next story and you know what happened next.
Yes.
I don't.
Yeah, that's the.
So you're sort of saying they've done this and they've done this. I'm like, nothing's happened yet because the babies. The babies have had the lungs issue, and I'm like, okay, when you started asking, I'm thinking I would certainly be asking.
Yeah.
Well, where's the blood come from then? Because I didn't have it yesterday. And if they started being defensive, I'd be like, well, you think about getting sued, but can you start my fucking question first? Like, worry about sued getting later.
They were refusing to answer. They were saying that they're not going to answer, that we have to wait, speak to the consultant. I think it was a few days before we even had a consultant conversation about why they were bleeding, because I think maybe they were trying to get their story straight or something. But the truth is, again, I don't accuse people without evidence. When I look at things from their perspective, I'm like, they're following policy because they have to follow policy because they work for the NHS. You can't just do what you want. And they're trying to stabilise children. They don't have malicious intent. At that time, the issue becomes when things go wrong. So nobody is saying that NHS staff are just out here trying to harm people. No. What happens is things go wrong either by accident, through them not following a policy, through a mistake. And what they do after that, that's when things get bad because they try to cover up or protect themselves. And that can cause a cascade of negative events through them not being honest. And that's why the duty of candor, which is a duty that they are supposed to follow, that's why that was established. Candor obviously meaning honesty. It's about what you do when things go wrong. It's not about thinking that nothing will ever go wrong. Things go wrong through no fault of anyone sometimes. It's about what you do after. It's about, okay, something's gone wrong. Now you're being dismissive of the parents. Now you're kind of misdirecting about what's gone wrong. I even had a conversation when we eventually sat with them, and I said to them, I've actually looked up into this a little bit and I found something called ventilator-induced lung injury. And I said, I think that might be what's happened. And she said to me, no, don't be Googling things. And I'm like, okay, but are you going to answer the question about, because I'm not an idiot, you know what I mean? I know that ventilator-induced lung injury is a real thing. So I'm saying, is it possible that's what happened? At first she's saying no. And later on, she's then admitted, okay, yeah, it's possible that it was ventilator. So then now I'm seeing, okay, so...
But you're kind of being gaslit before you get the truth.
Exactly. It's like, so when you think that nobody's going to question you on something, you're going to give one response. And when you get pressed on it, now you're going to concede and say, oh, actually, it basically was the ventilator that caused the harm. So I'm seeing this behavior of, oh, you're not honest. You are individuals that you're just going to say anything to try to avoid accountability.
Distance accountability.
Exactly.
I actually went to QMC 2 weeks ago into A&E.
Yeah.
I was taken, not by ambulance. I had a nerve issue in my back, that MC, whatever it's called, the sciatic, and I was screaming. And I already knew that there's something called cordioclampsia, which is where that spinal cord can be impinged, and the NHS are getting sued a lot for it at the minute. So I knew this because I came from an osteopath, and he said, what you're saying could be this, and if I manipulate you, you could be in serious, I could kill you. So he said, I know him, and he said, go to A&E, because this is serious. So I went, and when I went, I'm just thinking about what you're saying here and thinking they were trying to I was just trying to think what their side of it would be, because obviously people Google stuff and they think they've got like the worst thing ever.
Yeah, true.
I was like screaming in pain, like I'm a grown ass man screaming, and I had lots of morphine, lots of other medication. They were not taking any pain away.
Yeah,
but they weren't, as you quite rightly said, they weren't rude. They were really nice to me. They were really effective, but they also wouldn't accept that it could be that. Right. Because when you just said there about being sued, and I knew there's whether there's a chance or not until you had a scan. Everything is an option until you know it's not. Yeah. And it's a process of elimination versus, for example, like what I'm hearing when you say that is it could be anything. All we know is if they know that ventilator damage is potential, everything should be on the table of what could happen or what could have happened versus no, it's definitely not that. Don't be Googling things. It's like until we rule it out, you might have anything.
Exactly.
If you've got a headache, you might have a brain tumor. That's a leap, but it could.
Exactly, it could be. And do you know the interesting thing is, I don't even know. We later found out almost all of our assertions were basically correct. So she's kind of admitted, yeah, it could be the ventilator-induced lung injury. But what it is that there's something called the difficult airway pathway for ventilation in neonates. I've learned about this later on. And basically, when a ventilation goes wrong, there's an assessment protocol they're supposed to use if they ventilate again, right? To make sure that, because this person's experienced issues before, you're going to have to hyper-focus next time you ventilate.
If you have ventilated somebody and there's an issue, there is a process they should follow in that scenario.
Yes, that maybe not the first time, but this is why the first intubation is relevant. Because even if we grant that, nothing went wrong, it's just how things go, the first ventilation, they should now know this child is a difficult airway. This child is a patient who we've had issues ventilating before, right? So we're now so my kids were born 5th September. We're now sort of going more towards like 9th of September. My kids are getting better, but they're still getting like tubes of blood out of them. They're saying they might not survive. And then I'm at work on this morning, and my girl calls me, and and I'm like, "How are the kids today?" And she says to me, "Oh, that they're giving them more fentanyl than usual." And I'm like, "Why?" And she's like, I don't know. I'm like, what do you mean you don't know? Like, I'm at work. You can't just, what I'm saying? Like, this is stressful for all of them. It's like, what do you mean you don't know? And she's like, I don't know. And she's asked the nurse, and the nurse said she doesn't know.
Where did fentanyl come into this?
Because they give more opioids to try to relax the lungs. I found this out, obviously, when I asked them. They give the opioids to relax the lungs to synchronize the breathing with the ventilator. It's normal to give fentanyl and morphine when someone's on a ventilator. Obviously, I've not known this. And when we've asked, I don't know. So I've gone, I'm not, and they actually said, she actually said that the nurse mentioned it's to make her more, this is my son, to make him more comfortable. So you've just told us my son might die. Then you're saying we're giving him extra opioids. And when we ask him why, you're saying to make him more comfortable. Again, I rushed to the hospital. Sorry, mate, I've got to go to the hospital. My manager knows I'm on the neonate ward. Rush to the hospital. I get there, and this nurse is sort of standing over my son. And then I'm like, what's going on? She's just like, what? And I'm like, what do you mean what? I'm just like, why are you giving him fentanyl? And she's like, oh, I don't know. It's just to make him more comfortable. So I'd say this is what I did that was wrong. And I hold my hands up. I was wrong for doing this, right? I've got, imagine like your kid goes, they've got kids. Imagine a kid goes to school. You come on and then you say, oh, where's little Timmy? Oh, I'm not sure where little Timmy is. You're gonna be like, what do you mean you're not sure? Do you know what I mean? You're gonna sort of be like, what do you mean? So that's what I did wrong this time. I've operated from the perspective of a frustrated parent who's being dismissed and not being given full information. And I was wrong. And I've sort of said to her, like, what do you mean? Like, tell me what's going on. And she said she doesn't know. So I wouldn't say that I'd say I was rude in a frustrated way. I wasn't like attacking anyone, wasn't being like shouting, nothing, but I was—
No swearing.
No swearing. I was just frustrated, like a frustrated parent, right? So when I've said to them, like, what's going on? Like, tell me what's going on. Like, no, like, da-da-da-da. Other nurses have come and been like, right, look, you can't speak to her like that. Da-da-da-da. Let's come and have a conversation in Tyrone. So I've said, yeah, come and have a conversation in Tyrone. They said, look, the reason the baby's getting fentanyl is to synchronize his breathing with the ventilator. When they've explained it to me, I'm like, cool, I understand. And I've apologized. I said, look, I'm sorry. I'm stressed out. I thought something was wrong with my son. It's my fault. Shake hands. They've explained to us more. Yep, it's possibly the ventilator that's causing harm. No choice. It's a situation we're in. Everything's calmed down. And they've even self-admitted after this point, everything calmed down. Everything was fine. But what's happened now is from the interactions we've had so far, which is mostly really them being dismissive and rude to us, but then also me now expressing my frustration, they've now started to take it upon themselves to be extra mean to us. Because you got to understand, a lot of these NHS wards, they're like a mean girl environment. It's like cliquish. Like they've now looked at it like you're now the enemy because we've had to tell you that you've spoken to this person the way we don't like. And now it's like they're trying to attack back at us. So now what's happening is I'm now calm, everything's fine. I've relieved my trust. Even though I don't trust them, I've just said, look, we have to let go a little bit and let these people do what they're doing. So they're doing what they're doing, but then the nurses are now mistreating us. So we're asking questions, they'll just ignore us. Oh, excuse me, what's going on? You know what I mean? We'll ask them, like my daughter, she had her mask on incorrectly. So I'll be like, oh, excuse me, would you mind adjusting the mask? Oh, don't worry about it. I even saw a nurse carry my daughter with one hand. I said, excuse me, can you not carry my daughter with one hand? She said, oh, she's secure. And I'm thinking like, this is not how you speak to the parents of a child. Like they're now taking it upon themselves to mistreat us, whether that they don't like the fact that they've been questioned, they don't like the allegation we made of ventilator-induced lung injury, or that they think that I was rude to the patient. But I'm now when I say my best behavior, I'm talking about like, I'm actually scared because I'm thinking like, I'm scared of these people. They've got my kids, I'm not there. So I'm on my best behavior now. But then they're now, and I've found this later, they're now documenting. So say if I say something like, excuse me, can you not carry my child with one hand? They'll write down, Dad was aggressive to me today. And I'm like telling them like, when we later sit down and talk about this, I'm like, I didn't do anything, you realize that? And they're like, oh, it says here you was aggressive. I'm like, what do you mean I was aggressive? I was like, and when they're telling me like, oh, because we've heard that there's been instances of aggression, I'm thinking to myself, you know, that was my fault when I was rude to staff. But so every time they bring up stuff, I'm like, are they talking about the thing that we already went over? Like, but I'm realizing that they're actually documenting the times that they're aggressive to me as me being aggressive to them. So I'll say like, excuse me, can you not carry my daughter with one hand? And then they'll realize, oh, I shouldn't have done that. And then they'll write down, Dad was aggressive. And it's a culture in this place. And I think throughout the NHS of this defensiveness, and they call it DAVO. It stands for Deny, Attack, Reverse, Victim and Offender. It's a tactic that they use every time something goes wrong or every time there's a dispute. They will document it as if it's not their fault, as if you've done something, right?
As in, so there's a tactic and they're trained to do that?
There's actually been some cases that have suggested that there is policy within the NHS that makes them likely to behave in this way, based on being defensive or taking staff word over patients' words and things like that. I know some people that are suing the NHS based on some of these policies. But suffice it to say, whether it's a policy or not, it's a culture that they engage in. Okay, so now we move on. You know, the kids are still getting better. I think they eventually stop bleeding from the lungs. We're now around 15th of September. I remember there was this incident where, well, not really an incident. We got told the day before, oh, we're going to balance Adora's insulin with her glucose levels. We spoke to a consultant, great conversation, everyone in agreement. We've left the ward. They've then changed the plan, but they didn't tell us. Just a miscommunication. They didn't tell us. So we've come the next day, and my girl said to the nurse on duty, oh, excuse me, I thought you guys were going to change the insulin plan. Nurse turns around, points in my girl's face, shouts in her face, listen, you've been told. My girl's 5'2", this nurse like 6 foot tall. My girl, if anybody knows my girl, she's the sweetest. She doesn't shout. She's soft-spoken, you know, she's even a bit shy sometimes. Like, I won't say shy, but, you know, she's not, I'm outspoken. She's very quiet, you know what I'm saying? So the idea of what they try to accuse her of next is just, everybody knows it's a lie. Because when she's done that, I've not even intervened because I thought, be smart, don't say anything. You've seen what this nurse has just done. I've waited about a minute and a half. I've then gone to her and said, listen, you know, I'm telling you, we weren't told. Just in this exact voice, listen, I'm telling you, we weren't told. Like, you've not, you know, she wasn't here. So there's no way she could have been told about this change in plan. And you can see on the nurse's face, she's like, oh shit, okay, I've done something wrong there. They probably weren't told. And then she goes, all right, let me say. And then we've just stopped and let her say what she wanted to say. She's not said anything. She's like, okay, whatever, she just walked off. My girl's then gone and complained and said, excuse me guys, can we have a meeting? I thought we agreed everything was gonna be fine. The nurses are being abusive to us. Can you address this? We're not doing anything. We've not actually done anything. Everything's fine. The nurse is now being abusive to us. They've turned around and said to us, no, Sharma, you was abusive to her. So we're like, what? And before this conversation, my girl said to me, like, don't say anything. She just looked at me and said, you know, like sometimes your girl will just say to you, listen, shut up, just don't say anything, right? So I said, right, I'm not gonna say nothing. I've sat in this meeting and they've started accusing her of being aggressive to the nurse that was that aggressive to her. And I'm just sitting there thinking, these people are actually fucking liars. Because at first I'm like, is it miscommunication? And now I'm seeing, oh, they're actually liars. They lie when things go wrong. So then they're saying, and then they turn it on to me, oh, that I was aggressive to the nurse. I said, what? My girl starts going to, what do you mean? He wasn't even in the conversation. So you can see, again, twisting it onto us. So then, again, this time goes by. We now know they're lying about everything. 15th September comes along. My family came up to visit, my aunt and my cousin came up to visit from London to Nottingham, long drive at night, right? After work, 3 hours. So we're in, they've come onto the ward. We've got twins, so you're allowed 2 visits per child sufferer. So we're allowed 4 people on the ward. So I get onto the ward, I see my daughter, she's got like this mask on that's different from normal. So I say to the nurse, like, why has she got this mask on? Like, what's this? And I said to my girl, why has she got this mask on? What's this? My girl's like, oh, I don't know. The nurse says, oh, that the mask is to support everyone. I said, okay, whatever, right, cool. Then she said to me, do you want me to go and get the consultant? Because after that discussion where the nurse was rude to my girl, we had an agreement that, right, from now on, anytime there's a question, just ask the consultant. So when she said, do you want me to get the consultant? I said, oh yeah, get the consultant, that's fine. Then they send a registrar over, not a consultant. The registrar comes over and says to me, I heard you had some questions about the ventilator. But I wasn't even asking questions about the ventilator. I was asking a question about the mask. So I'm like, but because she said I heard you had questions about the ventilator, I'm like, I guess this is an opportunity to ask questions I have about the ventilator. So then I said, yeah, can you just explain, like, because we haven't been told whether the decision to ventilate was based on the policy or based on observation. I just want some more information. So she starts giving a really good explanation, being calm. She's like, yeah, basically, you know, it's just to keep the lungs inflated, that the lungs are kind of like balloons and that, you know, there's a balance of pressure we use, there's different touch. She's explaining it really well. So I'm like, okay, yeah, thank you, appreciate it. And then I say, okay, so I get what you're saying. So I said these exact words, I said, okay, so you're trying to balance the potential harm that the ventilator causes with trying to keep the lungs inflated. I get it. And then she's like, no, the ventilator doesn't cause any harm. So now I'm like, but the consultant said to us that the ventilator caused harm and that you're trying to balance it. Like, isn't that the same as what you're saying? And then she literally gets this look of like embarrassment, like, oh, I've accidentally gone against what the consultant says. And then she just goes, this conversation's over. But it wasn't even a difficult conversation, it's just a normal, just how we've been talking. So I'm just like, what is wrong with these people? So I'm just like, okay. So then there's like a incubator between us. She's on this side, I'm on this side. So then I'm like, okay. So that I walk off back towards my family. And then another nurse comes over from the other side of the room and says, listen, you need to get off the ward. And I'm like, why do I need to leave the ward? What have I done? And she's like, listen, if you don't get off the ward, I'm going to call security. And I'm like, can you tell me what I've done to make me need to leave the ward? Another nurse is saying to me like, oh yeah, you need to leave off the ward. And I'm like, can you tell me what I've done? Because this woman's harassing me. I haven't done anything to be asked to leave the ward. She came over to me and said she wanted to, do I have questions about the ventilator? I've asked questions and now you're telling me to leave the ward. Like, because I'm assuming she probably thought that I was questioning the staff unnecessarily, but she came to me to be questioned. I didn't ask for her to come. So she's telling me leave the ward and I'm just like, I haven't done anything. She goes, they alert security And my aunt's saying to me, listen, and remember, this is calm. This is not a charged situation. Just how I'm like this now, I'm like, what have I done? Tell me what I've done. I'm not raising my voice. I'm not being aggressive at all. I'm scared of them because of the lies that they keep telling. My aunt just says to me, listen, you know they're going to lie. Just leave the ward. I've left the ward. When I'm walking out, the nurse kind of like barges past me, being inconsiderate. I say to her, excuse me, what's your name? She says what her name is. And the first nurse who I was like rude to at the start. So then I've walked off the ward with my family. I get to the front of the hospital, break down in tears. I'm saying to my aunt and my cousin, listen, these people, I'm telling you, they are liars. Everything they're saying is lies. And I'm saying to my cousin, because my cousin's like my sister, I'm saying, listen, tell me right now, did I do anything? I'm going to say, look me now and tell me, what did I do? She said, Ama, you did not do anything. She said, Ama, I wouldn't lie to you. You didn't do anything. I saw you where you was perfectly calm. I said to my auntie, tell me now, did I do anything? My family don't lie to me. She said, Ama, you didn't do anything. She said she was being a Karen. That's what she said, right? So I said, okay, I know it's not in my head because my family's telling me you didn't do anything. My girl's telling me you didn't. And the thing is, they said to her, when they told me to leave, my girl said, what, are you saying all of us? And she said, yeah, all of you leave. So tell me now, if I've done something, why are they telling all of us to leave? Why are they telling my girl to? She didn't say anything. You understand? So my girl was upset because she's thinking like, why are they telling all of us to leave if it's because you did something? Why didn't they tell you to leave? So we leave, we call up, we do a complaint. We say, listen, your staff are being very abusive and mistreating us. We're gonna have a meeting about it. They say, oh, apparently I assaulted a staff member. I said, what? They said, yeah, apparently I assaulted a staff member. I said, what do you mean I assaulted a staff member? They said, yep, no, we can't talk about it now. You're gonna have to come in tomorrow. We come in the next day. I said, we're sitting down in the meeting with them, the consultant, she's the matron, and they're saying, listen, we're having complaints about your behavior. I said, you're having complaints about our behavior. The staff are being abusive to us. We're the ones complaining about the staff behavior. They're saying no, and then they're saying, tell us what happened yesterday. And after this point, is when we start recording everything. Now, from everything I tell you from now to the end, it's recorded. So if anyone doesn't believe me, the recordings are going to come out. You understand? Soon. So I'm saying to them, I've not done anything. And they're saying, we want to restrict your hours. And to be fair, he's trying to de-escalate. He's saying, doesn't really matter who's right and wrong. Let's de-escalate. But I'm saying it does matter because they're lying about us and we have to entrust our children to people that are abusing us and lying about it, right? He's saying, look, it doesn't matter, let's de-escalate. But then he's saying he wants to restrict my visiting hours. So I said, look, I'm not happy about that because if you're going to restrict my hours, it has to be because you believe I've done something. So I'm saying to him, tell me what you think I've done. And he's saying, apparently my tone. I said, okay, what about my tone? He said, oh, he doesn't know. He said, oh, maybe it's my stance. I said, what about my stance? I said, then I asked him, do you think that because of how I look, that's why the staff having to me? He said, yes. I said, okay, so you're saying basically it's not because of what I said. So I said, I asked him this question. I said, so you're saying I don't need to do anything in order to be perceived as aggressive? And he said, yeah. So I'm like, so I could literally just be doing nothing and they're going to say I'm aggressive? Yeah. So I said, okay, I see what this is. So they say that they want to restrict my hours. I said, I'm not happy about it. They said, okay, that they said what they're going to do is they're going to bring a security guard to come every time I'm on the ward. I said, okay. I said, bring a security guard every time I'm on the ward, if that makes you feel comfortable. They ended up not bringing the security guard because they knew that this is ridiculous. In fact, I actually believe that they know that the staff are lying. I don't believe this is the first time that they've behaved in this manner. They're very hysterical individuals, these nurses on this ward. So I come in and after this, everything's fine. 16, 17, everything's fine. We start forming relationships on the ward. My kids start getting better. Everything starts getting better. They didn't bring anyone to watch with us. Everything's fine. We're recording now, everything. And then on the 20th, they come over to us and said, oh, we've been reported to Children's Social Services. I said, reported to Children's Services for what? They said that I'm refusing, treatment. I said, what treatment am I refusing? Ben, we're now, 14th October 2025, yeah? This is 20th September 2022. To this day, I don't know what treatment they're saying I refused. To this day, they're saying, oh, I'm refusing medical treatment. I said, what treatment I refused? They won't tell us. I said, okay. Then when the social worker contacts us, I'm telling them, we haven't done anything, by the way. I hope you realize that they're just lying. They said, oh, apparently you're refusing treatment. I said to the social worker, what treatment have you refused? They said, I'm not sure. They later then started saying that, oh no, it's not that, it's not the refusal of treatment, it's that my girl refused the antenatal steroids at birth. That's why they're saying they've called children's social care on us. But the consultants are telling us, oh, the steroids don't make a difference, no big deal, it's fine, it doesn't mean anything. And they're also telling us, oh, your kids are doing the best on the ward. So I'm sort of thinking, so what does this have to, because they're putting it on me. So I'm like, even if you're saying that it's a refusal of treatment, I didn't refuse the treatment. So I'm like, what treatment are you saying I refused? Then they changed the story, oh, that I refused to put them on a ventilator. I said, no, I didn't refuse. I just wanted them to give us information because I didn't know what was going on. So they're like, oh, okay, you're refusing treatment. It's like they're so unsure of themselves. So this goes on. And then around this time, I think we're late September now. Things start getting better. So from 25th of September all the way to sort of 17th of October, nothing happens. Everything's fine. We're being friendly. I'm even there's something called Neonatal Star. I'm giving, it's like when you nominate someone for the best neonatal stuff, I'm doing Neonatal Star. I'm having conversations with staff and everything's fine. But little did I know, this woman, she's actually the one that's reported me to social services, the one who says that I was rude to her, whatever, right? She's reported me to social services. And they're asking her, I've seen the internal communications, they're asking her like, what is Ama doing? Like, what has he done wrong? And she can't give them a definitive thing. So she starts lying, she starts making up lies. She starts saying, oh, that I'm very aggressive. She's worried about the safety of the children and all this stuff. They come up with this allegation that I'm a domestic abuser. So I asked them, how am I a domestic abuser? Tell me how. They said, oh, that because my girl gave me her phone when she was in labor, that could be evidence that I take her phone and don't let her use her phone to speak to who she wants to. I'm like, she's in labor, so she voluntarily gave me a phone because she's in labor. So she can't be on her phone in labor. I'm like, what are you talking about? They're like, so they come up with that allegation. They later drop that allegation. It's not good enough for them. They're saying we refused medication. They can't come up with what medication refused. We speaking to the social worker. They don't know what's going on. They're confused. The social worker says, when we meet the social worker, they're like, oh, apparently you were aggressive and intimidating. I said, what did I do that was aggressive? They're like, I don't know. I'm like, well, don't you think that matters? So the social worker's like, right, we're going to drop the stuff about aggressive because she says, I've met you. You're a really nice guy. I can see you're not aggressive. She's like, you're fine now. I can see you're not aggressive. But we're now having to go through this social care investigation. But we're thinking to ourselves, because we haven't done anything, this is just going to get dropped.
The kids are still in incubators.
Still in the incubator, still getting all the treatment they need. Nothing's wrong. They're even documenting our interactions. Everything's fine. They're getting great with the kids, they're breastfeeding, everything's their dad's here in the evening, everything's fine. But the social worker and trying to come up with a narrative to justify why they did the referral. Otherwise, it's going to become obvious that they did the referral for no reason, right? So
what makes you believe that?
Because I have proof that...
what proof do you have that they conspired to do that?
Okay, so the proof I have is this later on, has done a police statement, and she said in her police statement that after the incident where I was rude to her, she said everything was fine and everything was perfect. And then she said that the reason she called social services on me is because of the event where they called security on me when I didn't do anything, right? So think about it. Her allegation is that I'm refusing medical treatment, but she's actually admitted in her police statement she did it after thinking everything was fine because she thought that I had a dispute with the staff. So she's admitted she called children's social care on me against my kids because she thought I had a dispute with the staff. And her allegation is that she said I'm refused medical treatment, but there's no evidence of that.
That's not evidence of the child services worker being somehow collaborating to... She's reported me to the children's social. She's worked for the family care team. So I'm not saying that at this time the children's social service worker is the one that's deliberate. She's taking the information from the hospital team and they're telling her that I've done this, I've done that. And there's actually a document that's been uncovered where she admits that I'm not refusing medical treatment, that she writes that I haven't actually refused medical treatment, but that she's saying because that she thinks, that something's going on. But her formal allegation was, I'm refusing medical treatment. That's what's pricked the ears of the social worker. Because remember, the social worker is saying to us, all this stuff about aggression, parents ask questions, no big deal. So are you saying that the trigger word or trigger phrase of saying refused
medical treatment,
you can then refer saying you've refused medical treatment for your children in this emergency state, And that's a trigger for social services.
Well, they didn't report us about the initial refusal. Again, they've reported us because they thought we had a dispute with the staff.
But they haven't said that though. They've said the refusal of treatment is the first one, right? The steroids.
That's what they started saying. Yeah, they started later saying that the reason they're
the real reason is you believe it's to be something else.
But the real reason is because
the dispute. But is that evidence, or is that what we think that?
What? Oh no! I know this because she's admitted it. She said that because of the dispute on the 15th of September, that's why she reported me to social services. You understand? That's what
But they used the trigger word to sort of justify.
They used the trigger word, refusing medical treatment. And remember, they're saying I'm refusing medical treatment. I didn't refuse the steroids at birth, so that's not the allegation of refusal. They're saying I am refusing medical treatment in order to justify a social care investigation against us, right? Mm-hmm. So the thing is, when they start investigating everything, all the allegations are falling flat on their face because they can't provide evidence of the what's been refused. They can't provide any evidence of what I've done that's aggressive. And when they go onto the ward and asking the nurses, is everything all right? The nurse is saying everything's fine, there's nothing wrong, right? So, and this is another reason, if you want more proof about why I know that she's lying, is because an event took place on the 17th of October where we weren't on the ward, for they have ward rounds in the morning where everybody gets together and they're asking questions about, they basically give the information, the updates, the handovers from the day before. And at ward round, we weren't there that day. Before ward round, they told us they're going to put Adora on something called high flow nasal cannula oxygen, which I told you about before. Mm. She's starting to get better, so they're decreasing her support. They told us we're going to put her on high flow nasal cannula. We weren't there for ward round. At ward round, they changed the plan and said what they're going to do is they're going to alternate her between oxygen, nasal cannula oxygen and CPAP. We come into the ward later that night. We asked them, what's going on? They said, as usual, they said, do you want us to get a consultant? We said, yeah, because now it's working well. So they want us to get a consultant. Consultant comes, heard you guys got questions. Yeah, what's going on? Is she going on high flow? Is she going on nasal cannula and CPAP? Then they explain to us, oh no, that she's going on nasal cannula and CPAP. Then they even write down, Mum and Dad happy with the plan of care. I mentioned about the high flow. They said, we agree with Dad that Adora could be ready for less support. They've written this down. We agree. Nurse agrees, doctor agrees. But because the nurse didn't know that we weren't there in the morning, she's written something to the effect of, parents reminded to follow the plan from earlier this morning. But we weren't there early in the morning. So I guess it's a mistake she's written. This event and goes and reports us to social services again and says that I caused a 45-minute delay to treatment and my daughter was struggling to breathe. This is not in the medical notes. There's no evidence of it. And the next day, my daughter was on less invasive support without my intervention. The next day, they decided, she's doing really well, and put her on less invasive support. They increased her time off of the CPAP, right? She's completely fabricated this event. There's no notes saying my daughter's out of breath. Their notes say, Mum and Dad happy with the plan of care. We agree with Mum and Dad. Everything's fine. Fabricated this note and said to social services, oh yeah, I really welcome intervention now because I'm worried about the children. But you've just made this up. So this is, again, Ben, how I know that she's fabricating.
Obviously, I know what happens next.
Yeah.
And so I'm very cautious with how I say what I want to say.
Yeah.
But for your best interest in my belief. And I always do what I think is right.
Okay.
I believe you. I have experience in the criminal justice system.
Yeah.
My dad was a firearms officer as a kid.
Yeah.
And I've also got a lot of experience on the other side of it and me doing some things wrong in my day.
Yeah.
If you were telling me the story, which you are, because you're drawing the conclusion, she's lying. She must know this. You're drawing a conclusion. And I'm asking what the facts of the conclusion are. I'm lying. I'm going, well, how would you know? So I'm just trying to, because obviously you're explaining the way.
Yeah.
I'm trying to go, so which bit's like factually, like, is it it's the 17th of this date and the babies were here?
Yeah.
Establishing fact. And so I'm asking, like, that's why I said the phrase I'm trying to establish, because when someone tells you a set of events.
Yeah.
First of all, for example, if you're in court, the barrister would be asking you to establishing. Yeah. So you were there.
Yeah.
You'd be like, yeah, but no, but I'm asking you a question. You're deferring over here. Now, obviously, of course, you want to tell the story because it's emotional to you. I feel that this is going to not represent you the best in terms of what you really, I feel, want from, I don't know, obviously, what your plans are to do next with, obviously, this obviously what's happened. I do know, obviously, the next part. I'm offering you this, take it or leave it. because I really want to get this across, and I want you to come across in a way I'm sure you want to.
Yeah.
And this is just my opinion, so I'm not being fucking wrong. And I framed it. I believe you.
Yeah.
I'm trying to just establish, like, what happened. Like, was it Thursday that happened? So, baby was in incubator, then this was said to you. Because if we just logically go along step by step, the audience will be able to draw their own conclusion. Yeah. You're trying to draw my conclusion for me. Okay. Because you would tell a story in a way that's making me believe something based on what you believe. So I'm feeling like, well, do we know that though? Because so, for example, there was a report made to social services. Yeah. The person who made the social services report used a phrase that we now know to be dad refused medical treatment on the behalf of the children. Yeah. That is a key phrase that they can use, copy paste, which would justify a report. Yeah. Now, that report, that filing was only made X amount of weeks after that event happened. Convenient.
Alleged event,
Alleged event. Well, no, the event happened as you did refuse the medication. I
didn't refuse it, no.
The medication was refused.
Yeah, okay. The
steroids were refused. Yeah. For whatever reason, no problem. But then there's only reported here the day after we've had this security event. Right. So that's the facts. The medication was refused. Who cares why? Yeah. In this moment. We had this altercation or disagreement or whatever happened. Yeah. The security was said they were going to come. They didn't come. But then the next day, this trigger word from this event was now used to justify this report. Right. That's factually true. Yes. Now if you told me it like that, I'd be like, well, it would look like she's now unhappy at this thing here and then use this against you. Yes. Which is what you obviously think. Yes. But I can draw my own conclusion from you just telling me the facts. So when we went into labour, we collectively, my partner, refused the medication based on the fact we had no idea it was labour. Okay, yeah. Then we had an altercation and different events happened with the staff, and it seemed like we weren't getting along with them. Clearly the communication broke down, we weren't received well, they didn't like us, we didn't like them, whatever. And then we had this situation where the security were going to be there because I'm now apparently, they reported me to be threatening, whether I was or not. Regardless, they reported me for threatening, therefore security were now mentioned. Yeah. And the next day there's a social services report made. That's the fact. Yes. Now I can draw a conclusion. Well, that seems a little mighty strange how it took X amount of weeks to go from saying that. Because if they were genuinely concerned about the children's welfare because of you, because of this event, they would have reported it. It should have been then. Exactly. But if you tell me to think that, I'm like, well, why were you telling me to think that? How does that benefit? Does that make sense?
I totally understand. It's not because I'm trying to control the narrative. It's because I have other information. So put it this way.
And so that, I'm sure you do. That's what I know you do. And so if you let me ask the questions, then I'm going to go along going, okay, so why do we believe, you hold a belief because you've got more information than I do. So if I ask you a question, I'm like, so why would they do that then? Because why would this person do this? You're like, that's a good question because they actually did this other thing. Like, so I'm unpacking the story in my mind. Okay. And you're then saying, good question. No, you wouldn't think it mattered until then the lung situation that they said definitely didn't happen actually got proved to happen.
Yes, because not only, so put it this way, I'm not making allegations of intent against everyone. I believe at first when my daughter died, I thought, oh my gosh, they're all lies, right? After doing more research and examination, I've come to realize that there's a large percentage of them that just genuinely believe the stuff they're saying, but they're being misled by other individuals of staff. So the people that I'm trying to make, let's say, formal, direct allegations against, those are the people that I've got them banged to rights. I've got them either.
But I'm not challenging whether you do or you don't. I can't even get to what happened. Because as I said there, I'm struggling to follow exactly what is fact and what's allegation and what you could have banged to rights. Because when I gave you that feedback, you said, I'm not trying to do this. Like, I didn't know anything about intent. I'm not even challenging whether you do think they have intent or not. I hope that no one works in the NHS intent went to work that day to cause this family harm. Right. I believe something's obviously gone very wrong. Yeah. And it's obviously at your family's loss. Yes. And I'm trying to establish what happened, when along the line we put the ventilator in, not to deliberately to cause harm, but clearly something's happened. Yes. You mentioned the policy where there's been a ventilation issue, then they should be more sensitive, and that should have happened, and that was a failing there. That's a failing clearly of a policy that they should have, because something went wrong, then done something there. So that's the first one of the first issues. And then there's probably been a succession of issues on their part, which you say because of the fact they're trying to cover up, that potentially, because you don't know that's the case, I don't think, you can't prove, because one lie got told or cover up happened, that definitely led to the situation going the way it did. But it could be. So just like you've asked that particular nurse, I think it was a nurse, when she said about it could be the lung issue, she said it's not. I'm always saying to you, it could be. It might not, definitely not be. It's not definitely. You're saying it definitely is. But you can't be definitely sure, as they couldn't be sure it wasn't. Because if we say like this, the ventilator got put in, I'm already thinking, well, I wasn't there, so I've got no idea whether ventilation caused harm. Unless you've got a piece of paper that says, we've done an investigation and it did cause harm. But we can come to that conclusion based on, one, that evidence, and two, something obviously went wrong, clearly, along the line. Would it have gone wrong because they were 25 weeks born? Or because of 25 weeks born and then this set of errors? Because that then, one, talks to the errors in the NHS by those particular members of staff, from communication, from the sound of it, and from blatantly lying. Because
there are blatant lies involved.
So there's blatant lies, there's blatant policy, there's blatant things they don't take care on, and also the cover up. But then when you think about not wanting this to happen to other families, as I'm sure you don't want to have happen, how do we understand what needs to happen differently if we don't actually understand fully what the facts are of what they did? Because if someone else was listening to this, I know doctors, I know surgeons, they're like, I hear what you're saying, it's obviously a tragedy, but we are trained to do this in this moment. How do we know? I can't get to that point in the story, because you're telling me exactly like the version, the belief of what happened and whatever evidence. If we just go piece by piece through it, then obviously we want to get to the part where I know what you believe. I want to get to know how you feel about this. Obviously your feelings about this are the most important thing, really, obviously, apart from obviously what happened. But we want to find out what really happened wrong in the NHS. Because if we find out that, this could obviously make a big difference for the next evolution of the story. And also for other people, because I'm trying to understand, okay, so shouldn't they put the ventilator in? Okay, they should put the ventilator in, but then, okay, you've obviously come in frustrated, quite rightly. So should an independent body be involved when this happens? Because clearly they're going to protect their own, or maybe they don't even know, as you said. So shouldn't a senior consultant be involved? As soon as it's been something where something's happened, potentially there's been a risk of negligence or a mistake. Shouldn't there be immediately a red flag go up that this family is now a risk family?
Well,
for example, I'm just making this up off the top of my head.
It depends on what their alleged risk is. If they are genuine, if there's a genuine...
No, just to be clear, not you as a risk.
No,
a risk fine. Family being as in they've caused damage.
Oh, as in something is a risk.
So there should be so for example, as soon as something happens, as in they've made a mistake. They should then be thinking we need to manage this, because not lying. I mean, we need to be there to make sure that a family liaison officer would be who's independent from the hospital, who has nothing to gain by the hospital being sued, or they're just in the middle. It's
that would be a good solution if they were truly independent. So what has ended up happening in our case is, once they have alerted social services, it's not independent. Then they are being biased by false information given to them by the hospital.
See, they aren't being biased by false information. They are just being given false information. Now, what they do next, again, if you told me what they did next, I might believe what you believe, which they're biased. But let's just say Susan, make-up name, from Child Services walks in. She's told false information. Then she speaks to you. And then she decides that there's no risk to you from you. And she rules it off. She's not biased.
That's true.
If she did something else, and then we learn that what she had the information, did she make the right decision based on the information?
Yes.
But was the information wrong?
That's a great point.
Where's the flowchart? She was given information, and therefore she investigated it, and then it actually turns out the information's wrong.
Yeah, so it could be that, there was just false information given to her. She doesn't have malicious intent. I totally understand what you're saying. I get it. I understand.
So,
that's why the facts matter, right?
The facts matter. The facts matter. That's why I want the facts.
100% get it.
So let's say, so tell me then. So she reported you and the family to Child Services based on that trigger word that we mentioned earlier.
Yes.
To do with this refusal of medication, which we think or we know is in relation to the steroids.
That's the problem. They keep flip-flopping. So
we don't actually know what they're saying.
It's nothing to do with it. Sometimes they're saying that is why, because they don't have there's no clear. I refused. But
they're saying you refused it, not it was refused.
Yes, they're saying I refused it. I'm like, I didn't refuse it. Then they're saying, okay, it was refused. I'm like, okay, what's the issue?
There's a big difference because one's putting you in the light and one's not.
And they're saying everything's fine with my girl, but it's me. So they're saying I refused it. I'm saying, what did I refuse? And then when we're asking the staff, okay, what's the issue of us refusing it? They're saying it doesn't matter. It's not even an issue. I don't know why they're bringing it up. That's what.
So what happened with child services? Child services got involved with false information.
Yes.
Which we've now proven is false.
It's been proven in court that their information was unsubstantiated. Yes.
Unsubstantiated or false?
As in, we didn't have a finding of fact hearing. They dropped their own allegations.
So it's not necessarily false. It's just they can't
it's
prove.
unsubstantiated. As in,
which means you can't prove it to be true.
Okay, but
so that's a very big difference.
Yes, but
in a court of law, unsubstantiated fact is just hearsay.
Exactly.
But that doesn't mean it's false.
It could, theoretically, and that's what we're going to find out in the court case,
Correct.
right? Is whether it's going to be true because there's going to be a fact finding.
Yeah.
But the problem is that they made the allegations, right? So again, let's go back to the example. And stole my dog and smashed my window, right? If someone comes and starts investigating, did you do this or not? And then you yourself say, I didn't do it. And then I change my mind and say, actually, Ant didn't steal my dog and smash my window in. What he did was he broke a glass. Already you're going to be like, what happened to the stole my dog and smashed my window in? And then imagine you say, I say, no, she smashed my glass. They're like, okay, so let's investigate whether he smashed the glass. And then you start, and then I say, he didn't smash the glass. What he did was he broke my camera. So you can see by the behavior.
Quite, I totally agree with you. But also, you're quite right. But also, if we said, have you got CCTV of him smashing the window and stealing the dog?
Yeah.
No. He definitely was there though. But have we got proof he was there? No. But we haven't got proof he wasn't there. But we also haven't got proof he was there. We have nothing. We have just no fact we have no proof.
Yeah.
So I'm trying to establish what, as you quite rightly said, is going to be found out in court, whether that was unsubstantiated or lie.
Yes.
Because there's a big difference.
There is a difference. And that's why when we're suing, we're not just suing based on the fraudulent information, so the tort of misrepresentation or whatever, fraud. We're also suing based on negligence, as in you documented something that you may have thought it was true at the time, but it's negligent. It's affected us in a negative way. You should have done a better investigation as to whether it's true. Something can be, as you've rightly said, something can be false, but not necessarily be a lie. It's only my belief that something's a lie. I haven't proven in court that it's a lie. But what I can tell you is that it's unsubstantiated. And the reason why it matters a lot that it's unsubstantiated is because of the scale of allegation and what the allegations mean. If you make an allegation...
So because I'm still, again, quite unsure, what allegations did they make? So first of all, we've got steroid one.
Yeah.
And then what other allegations did they make since that?
I was aggressive and intimidating, that I was coercive over my girl, that I've refused medical treatment, and that I'm causing delays to treatment.
One by one.
Yeah.
The medical treatment, we think, but we're not sure whether they're referring to the steroid kind or something else because they changed their mind.
Well, they dropped the allegation in the end.
They dropped the allegation, but we don't know exactly where it came from in the first place. They're not saying it was definitely at this date and time. He said this. They haven't got that.
Yeah, there's different things. Sometimes they say we weren't refusing it. Then something they can't make up their mind.
That one's basically unclear.
Unclear. Yes.
Next allegation they made, coercive. They dropped
that allegation as well.
But they did specify that was because you took the phone.
I didn't take the phone. She gave me her phone. Yeah.
The phone was taken in labour, and that's what they're saying is the reason for that.
Apparently, yeah.
Apparently, they have definitely said we've served that allegation.
They didn't formally make the allegation. That's what the social worker said to us. Or
that's again on to substantiate again. It's just like here's a.
Yeah.
So we're not sure, but they dropped it.
Yes.
So that one's gone. That one's gone. What's the next one?
They said that I'm causing delays to treatment,
which is in relation to.
I don't know, because they later cut. So there's more allegations they come up with, because it's like they're trying to pin something on us. It's like they're trying to throw shit at the wall, but nothing's sticking.
It's very messy, right?
Yeah,
I'm like, so they're making so obviously stuff happened. Like you obviously frustrated. So now, as soon as a man, whether black or not, I've definitely had this experience. He's unhappy, angry. Like fucking hell, I was asking you a question about why the fucking food was late on the table.
Right.
You're like, I was just asking what happened to my baby because look, the baby's got this thing, and I'm asking you a question. Now I'm angry. That's what happens, right? It's ridiculous. I completely agree with you. And then they don't know. They're not making actually a solid claim. At 11:32, he said X, Y, Z. They're saying at some point we're not sure, but we don't like this fact. We're not sure, and then we'll go away.
Yeah, but they later start doing that because after, just to get a little bit back to what I was saying, after this that I've caused a delay that's caused my daughter to struggle to breathe, they escalated it to something called Section 47, which is the child is at significant risk of harm. So whether or not all of the allegations previously, let's even if we put them to one side.
That's all relevant then. That's the moment where
that's the key thing that they're like, you've done that, but that didn't happen. That's the completely fabricated claim.
So okay, cool, like there's a lot in there.
Yeah.
So what happened then in the build-up then to you allegedly delaying treatment? What was that in relation to?
Nothing. It didn't happen. They just said.
But what event went on to cause?
That was when I was asked. We weren't there in the morning. We said to them, "Why is she on the CPAP?" And
but this was now we were coming down as you said, we're coming down the severity of intervention.
Yes.
And that was discussed with the medical team.
Yes.
Then that was taken down.
Yes.
And then the daughter started to struggle to breathe.
She didn't struggle to breathe. She just made that up. It didn't happen.
So that didn't happen?
That didn't happen at all. She wasn't struggling to breathe.
So where did that come from?
She's just made it up. This is what I'm trying to explain to you, is that this individual is a malicious actor. So this is what I've been trying to explain to the police. This is what I've been trying to explain to the governing bodies. And she's being investigated as well by the NMC, because so a lot of people don't understand. There's actually a work that I want to read on this soon, which is about psychopathy in the medical profession. I'm not accusing her of being a psychopath. I don't have evidence of that. But people struggle to wrap their head around, well, why would somebody who's supposed to take care of people, why would they attack? Why would they falsify notes? Why would they lie? You are a normal guy. You might not just come along and say, I'm going to make up a lie about someone, but you don't think the same way as an abuser. Some people are nonces. They abuse children. Nobody can, if you ask me, why did someone abuse children? There's no frame of mind I can put myself in to understand it. Okay, maybe this, maybe that, maybe the abuse. None of it makes sense. It's just, they're an abuser.
But we were coming with it. Again, we're drawing a conclusion.
Yeah.
So like, this rounds happened in the morning and it was agreed. It was agreed or it wasn't agreed?
They agreed to decrease her oxygen, to put her on.
But that wasn't on your recommendation, that was theirs.
No, that had nothing to do with me. I wasn't even there.
Right, so they made a medical decision to de-escalate her care due to positive progress.
Yes.
There was never no struggling to breathe.
No struggling to breathe.
So we have no idea where that came from.
No delay, no struggling to breathe. I've got forensic data on my phone showing there was no delay. So
what happened after that then? Because obviously that's just not a non-event, but if there's no evidence or anything to suggest anything to do with that,
exactly,
we've got no idea where that came from. So like, again, we can go back and analyse whether she's got X, Y, and Z, but we don't. What happened next after that then?
So they've then had a secret meeting where we didn't know about. We're just on the ward thinking everything's fine. They've had a secret meeting. In the meeting, they've decided that they're going to escalate it to a Section 47 and start
based on the fact that
based on her false allegation,
based on the fact that she alleges that you delayed treatment and then your daughter struggled to breathe, which we have no evidence to prove is true. We have evidence to actually suggest it isn't true.
Yes, and they didn't ask us for evidence, and she didn't provide any evidence of it. She just made
it was escalated as a Section 47.
Yes.
Which is extreme.
That's like serious, that you are at risk of serious harm to your child. That's what they're saying.
And then what happened after that?
And then after that, we're just on the ward thinking everything's normal. The social worker contacts us, tells us it's been escalated to Section 47. And we're like, what the fuck is going on? Because they didn't tell us why it was escalated. When they then came and had the meeting with us, they started bringing up all the stuff from before. So we're like, well, we weren't aggressive. Everything's been fine. And we're like, what medical treatment did we refuse? They're not telling us. Then they're saying, why did I try and remove my daughter's oxygen? I said, I didn't try and remove my daughter's oxygen. What are you talking about? Then they're saying, why did you cause a delayed treatment? I said, I didn't cause a delayed treatment. So, and this is recorded. You can even hear, I might even send you the recording if it might help you. When they're asking us these questions, it's like we're being bombarded with stuff and we just don't even know what they're talking about. Because they're saying, oh, you did this. And we're just like, what are you on about? Because we're on the ward every day, liaising with them, smiling with them, everything's fine. And then when the social worker comes, she's like, well, this happened, this happened, this happened. I'm like, no, it didn't. So then social worker's saying to us, why would they lie? And then what can we say other than, I don't fucking know.
Why would we?
And then if we're doing this, why are they still letting us on the ward? Think about it. Imagine I did that.
Quite. But it's all. I'm just saying, like, if the Section 47 was issued for whether wrongly or not, they'd follow a process to not invite the parents to that because that would be the process.
Okay, I'll accept that.
So then I'm like, okay, obviously the information seems like it's wrong in the first place, which is obviously a whole other issue. But the issue is not the fact they're a secret meeting, because that would be what would make sense. If a family was abusing their children, you, I'm sure, would agree, let's keep the parents out of this and deal with it.
Okay, yeah, great. But then would you not also tell them that they're not supposed to be on the ward with their children? Why would you leave the person?
Well, the next question I'd ask is then, so why were the parents still allowed? If we believe this to be true, why was the parent still there? That's exactly what I'd ask. So as you said, because you've hit the nail on the head, because you've said that piece, that's what I'm saying to you, what my previous piece was. Because as you are telling me the secret meeting, the malicious actors, I'm like, I'll come to that conclusion on my own. That doesn't make sense then, because why would they say that if they would do that? I would then be left confused, asking you more questions, so you just go, quiet. Because then the question's already up, like, well, why would they do that? Because you're quite right. Why would you be allowed on the ward? Because if you were being abusive and they genuinely believed you or had proof to suggest that you were, you'd be arrested.
Yes, because the problem is there's a discrepancy between what the people in this family care team, what they're telling social services and what's happening on the ward. Remember, they aren't on the ward.
So that's a new piece.
That's a key.
That's a key piece I've missed.
The people that are speaking to social services are not on the ward.
Who is this woman? Where's she come from?
So she was on the ward at one point.
So she was on the ward?
Only for like that one occasion. That's
which is the one where you're rude?
When I was rude, yes.
So she's now got a preconceived idea because of one event on the frustration day that you are now rude black man.
Exactly.
So you might as well be in the text as rude black man.
Exactly.
And so then everything that's come off that is because of that.
And then everything she sees and knows, she's misinterpreting it. Let's not say lying, right?
She's read the notices. Father had to be reminded, which sounds like, or could be taken to, he forgot or didn't know, had to be reminded, doesn't care about his kid.
Exactly.
Okay.
So she's been tasked by Children's Social Care with making a chronology of all the events that involve me. So what she's done...
Again, makes sense.
Exactly, but what she's done is she's taken every single event that's happened and twisted it. If we make a complaint about the staff, sure, right, Dad was aggressive.
But so my point to you and before was that if we went through everything in a chronological order that happened factually, and then how they're spinning it, then I'd ask you questions like, well, so why, when she said this, that you were rude, tell me about that day, you'd be like, well, what happened was, like, and I was out of order and this happened. And I'm like, makes sense.
Yeah.
So then you'd squash out, I'd be like, well, that doesn't make any sense from her side. Then we get to the next bit, we're like, well, what happened was they put a ventilator in, so I just asked because I Googled it. Yeah, fine, I Googled it. There is a chance, because there's papers on it, that it can cause this.
Yeah.
So all I did was propose that there was a ventilator involved. Is there any chance that this could happen?
Yes.
I think it's a reasonable thing to ask.
And what she does is when she sees an incident like that, she documents Dad refusing care, or she documents Dad being aggressive, or she documents Dad causing a delay. She's using keywords I'm alleging she's using keywords to misrepresent normal events that any parent would do. Ask questions about my children's care, ask if we can speak to the consultant. She's writing that as this is the delay.
She's almost, but you're kind of doing it from one side and they're doing it from the other, and I'm trying to play in the middle because I'm just trying to establish. What I mean by in the middle is she's turning it towards her side, biased, and you're turning it towards what you believe.
Yeah.
Versus the facts are she made a claim based on this information, and then the claim was removed, and then the claim was unsubstantiated, and then we're not really sure what happened, and so I actually got a clue.
Okay.
But then what happened was the next thing happened, which was the same. Then they did this, then they did this. So I've got 17 events where there was claims, then there's not claims, then it was a claim.
And
not sure.
This is a pattern that continuously repeats, which is being caused by their miscommunication. Because you got to understand.
But hear me out. So let's say there's 17 miscommunications.
Yes.
Not miscommunications. The ones where they've made allegation, then took it out, and then took it. You now, because of the 17 together, you believe this is a clear pattern of this.
Yes, because...
But I'm still not at the 17 where I've gone, fucking hell, this is bullshit.
Okay, because...
So I'm just going, I'm sure that I'm trying to go, just piecing them together one by one.
Yeah.
I'm going, well, that can't be true because she's done this. Then that happens and this. And you keep telling me the factual things. And at the end of it, so I believe they've fucking been negligent. I go, I agree.
Yeah.
Whereas I can't fully agree. I'm almost struggling to agree because you're telling me your conclusion of the total without, I understand all the parts.
Okay, but there's more events. That's why. So there's another event that took place where we came on to the ward. We said...
after Section 47?
This is after the Section 47. They're saying, this is Section 47. We're saying, what's going on? We're still...
So they had a meeting, the secret one, the team,
we weren't involved
the collaborative team one, whatever you said it was.
Yeah.
And then you still have an award. Carried on as normal. Social services were involved.
Yep. They're only visiting like once. They've visited like twice, I think, at this point.
And so you're still on the ward.
Yep.
Now another event happens. What is the event?
Well, nothing actually happened again. We were on the ward.
Mm-hmm.
My daughter has something called a saturation probe, which measures her oxygen. My girl's changing her nappy. When you change the nappy, you have to take off the probe. So she changes the nappy, takes off the probe.
On the finger or
it's on
ankle.
Like the ankle, yeah. So she takes it off. She puts it back on. The probe is being dodgy. She calls the nurse over. She calls me over. Says, "I think this probe's been dodgy." We call the nurse over. "Excuse me, I think there's something dodgy with this probe."
Dodgy because it's now not giving a reading.
It's been given faulty readings for the whole time, and they've admitted later as well. Yes, these probes are dodgy. They changed the probes out later for the whole ward. So what we identified, something's wrong with the probe. We called the staff member over. We said, "Excuse me, the probe is dodgy. Like, can you check it?" She checks the probe and says, oh, the trace is fine, but we weren't saying the trace is issue. But anyway,
what's the trace?
The trace is like the thing that monitors how well the probe's connection is. But the problem is that you would sometimes have it where the trace is fine, but the numbers are off. I've actually got recorded videos where you can see that the probe is showing is connected with the trace fine, and I'm holding the probe.
No, not connected.
Not connected. So I've got this on video, mate. So the probes are having issues. They know, I've got other recordings of staff members saying, yes, there's something wrong with our probes. Other ones, yes, we've changed the probes out. Everyone I know is complaining about the probes. Everybody knows the probes are an issue. We tell the staff member, excuse me, we think the probes, and she says, oh, the trace is fine. Then she said, and then I think another nurse comes and says, oh, do you want me to get another probe? Yes, they're going to get another probe. This is a completely routine thing. Anyone that's been on a neonatal ward, they know what I'm talking about. It's totally normal. The nurse comes, changes the probe. This staff member document, and she's part of, round of applause, the family, or drum roll, sorry, the family care team. She's part of this woman's team. So remember what you were saying about how are you building the picture together. So we've got this individual who's done the referral. She's the one that had I was rude to her. She's responsible for doing the chronology. Then we start seeing people who share a room with her in her team making allegations against me that I allege are false. So let's say there's 6 main allegations. 5 of them are her and her friends in the room out of 50, 60 people. So now you can do the maths on that.
So the woman who's coming to then change the probe is her friend on the ward, but also part of this.
But also part of the family care team.
Care team.
And
So are you alleging then the family care team has a cultural problem? Because you haven't alleged so far, unless I'm wrong, that anyone else within the NHS, apart from, there's maybe the culture of the whole cover-up stuff.
Yeah.
But really it sounds like so far it's this team of people.
Yes, that could be said to be correct, but the problem is that the cultural problem is not necessarily that. Like, for example, let's say the consultants, they haven't directly said, oh, I had this experience on the ward. All of them have said, actually, they had all positive experiences with us, everything's fine. But the problem comes when, if I make an allegation, your staff has done this, you and the consultant covers up that allegation and leads with, this is what my staff are saying. That's a cultural problem where they're being biased.
True, but walk me through that then. So walk me through when that happened. When you made that allegation of the staff, that team, what did the consultant do that led you to that conclusion you made there?
They generated a report. So social services asked them for a report. The consultants, I think it was 3 of them, they generated a report that basically says, like, this is all of the summary of the events that have happened. And the conclusion of their report is that we're at risk of significant harm to our children. You understand? But their report is made up of all of the things I've just told you about, half of which didn't even happen.
Yes,
you understand?
But what the consultant would see, as you would also, if you're a consultant, I'm assuming, again, I'll clarify this with you whether you think I'm wrong, is if I was given a piece of paper that said, these are all the reports, these are the claims that staff have made, I would add all the claims and say, if those are true, because I wouldn't assume the line, that would be a risk of significant harm.
Right.
And what you're saying is, the consultants have nothing wrong, in my mind, by saying a risk of harm, as long as those things are true, which we're saying are not.
Ben, there's something in the NHS called the duty of care. Duty of care means that when they document things, I understand what you would say, oh, I'm a consultant, I'm just going to read what the nurses say. They have a duty to ensure the things that they're saying are true. If I'm telling them this is false, they have to go to the medical notes and cross-reference it. They have a duty to do that.
If you say it's false,
yes,
because as soon as you make an allegation that that's false, then they would have to then look to see who's telling the truth.
Yes, and if they refuse to investigate it, they extrapolate further false inferences from it, like they say, oh, you caused a delay to treatment and this delay could have killed your child. Okay, well, first of all, the delay didn't happen. Second of all, you have no evidence that it would have harmed the child, even if it did happen, which it didn't. So the consultants are not benign. They're part of the culture, not necessarily being on the ward, but they're not, they act to bolster the position of the ward.
What you're saying is they're complicit.
They're complicit,
due to lack of standing up when potentially things are wrong.
And also because they corroborate events without doing any due diligence about them. And they frame events in a way to what? Protect the ward from litigation, to protect the ward from accountability.
Obviously, I know this is it's a serious story here. I used to be a firefighter.
Yeah.
It's such a different culture in the fire service.
Yeah.
Because they're not looking to discount blame, because they do not want situations that reoccur where either a firefighter or, unfortunately, the public lose their life or is at harm. So there's never that. As soon as you're involved in an incident in the fire service, there's a lot of officers immediately involved, higher ups, who are looking at not fault of just you, fault of the flight of your team, your watch, your people, to then stop that from happening. Because what you're saying is, because they're then also being lent on by their management probably, and then the reputation of the hospital, and then the trust, they're then just they're confirming facts are true, or they're confirming the report is correct without doing any reference, due diligence. Yeah. When you are making an allegation, that is not factually correct.
Yes, I'm formally telling them this is not factually correct. And again, my opinion is they are aware. Again, I can't say for certain because I know you'll pull me up on it, but I believe that they are aware of what's correct and what's not correct, but they're backing up their staff.
So you genuinely believe the consultants who have made these reports,
yes,
do believe that the nurses and the family care team who have made these allegations, do you believe they think and know that they are actually lying?
I think they know that a large proportion of the allegations are false, yes.
What makes you believe that they know?
Because when some of these events eventually went to court, what they did was they started deleting parts of the notes that prove what I'm saying is true. So they'll say something, they'll make an allegation like, AMA caused a delay. And when you go to the medical note, it'll be like, this happened. And then at the end of the note, it says, Dad visited quickly, happy with the plan of care. And imagine this is an A4 sheet. They'll send a sheet this long in their court evidence. Where's the part that says Dad visited quickly, having the plan of care? This is the consultants doing this. So they're editing.
They've changed evidence?
Yes, they're editing the evidence to make it look like I've done something when I haven't done something. In addition, if we make an allegation, like for example, there was a time where they did something called a lumbar puncture on my kids without consent. We're not against them.
When did that happen?
So there again, my kids.
Is this after Section 47?
No, this is earlier, before the Section 47, but we only found out about it later. Oh, so an example, they'll do this medical procedure. What
is a lumbar?
It's like they get some like fluid from the spine. I think it's called like cerebrospinal fluid. They get some of it and then they test it for meningitis, right? But they're supposed to do a formal consent procedure with the parents, right? This is just one example. They didn't? They didn't ask for our consent. Then they document in the notes, the consultants did this, they document in the notes that they asked for our consent and we said yes.
Verbally.
When we tell them, by the way, guys, we didn't get consent, we're just letting you know you didn't get our consent for this. What they'll do is the next day, all of a sudden, they're documenting, that I'm aggressive and I'm delaying treatment. So it's hard to combine it all without seeming biased, but because it's a culture. It's a culture. But
you're saying the facts are that were you unhappy with the test they did?
I wasn't unhappy. They didn't get our consent. That's called
you were just pointing out.
I'm pointing out
you didn't do it, and then the next day.
Imagine if they got our consent and did it. No issue. Imagine if they did it without our consent and it was a serious concern. No issue. They've written in the thing we consented.
They're trying to muddy your character, right? By randomly putting these bits that just when you read it,
they're doing what they want to do. When we say, excuse me, can you respect us as parents and respect the consent procedure? They are fabricating notes, allegedly, to make it appear that we're just crazy and we're just saying stuff. They did get our consent, but they didn't. You understand? So this is a culture where they are used to transgressing. They are, in my opinion, they are used to circumventing parental consent. They are used to not being held accountable when mistakes happen. And what they're doing is they're deflecting their own negative culture as if we are the problem. We aren't the problem. What it is that this culture has been allowed to persist. And this is where it talks about the expansion to the larger NHS. I'll give you some other key points. The Health Secretary, the Parliamentary Health Service Ombudsman, the government, so you can look at the Darzi report, these are the most senior health officials in the country. They've all admitted that there's something called a cover-up culture in the NHS. Yeah. What I'm describing to you, if you didn't know anything about the NHS, you would think, okay, this guy's making loads of wild allegations. But this is a documented thing in the NHS called cover-up culture. Yeah. In addition, the ward that this has happened at is subject to the largest maternity investigation in NHS history. Right. So it's not just me. There's 2,500 other cases of baby death, baby brain damage, serious harm, mother death, mother serious harm. I'm not talking about, I was really upset because you did something about my consent. I'm talking about this child has cerebral palsy now. I'm talking about this mother is missing an organ. I'm talking about, and when you speak to these parents, which I do regularly, they remark upon the same things. I said this happened, they lied about it. I received my medical notes, they were doctored. I raised concern, they caused me aggressive and intimidating. When you look at what's the other hospital that they did? I think it's Shrewsbury and Telford. Shrewsbury and Telford, they had a scandal, if I've got the hospital right. And when you see the results of their investigation that they did, the inquiry into the baby deaths there, they found what? Doctoring medical notes, culture of cover-up, not listening to parents. I've done my own investigation into our experience on the ward. The conclusions I came to, I've gone and looked at the Shrewsbury and Telford one, and it's the exact same conclusions.
So that, and they are not the same teams, not the same nurses. So you're talking, exactly. That's just culture. Like that's the NHS, and that's the NHS. They are not related people.
Yes, and this ward, this hospital trust that I'm alleging killed.
Are they the same trust?
No, they're different trusts.
Just the NHS.
Which is up and down the country. But this particular trust is being investigated by Nottinghamshire Police for corporate manslaughter. There's no other trust being investigated. That's a criminal investigation.
This is Nottingham.
This is Nottingham. This is the same ward, right?
And they've been investigated by the police.
They're currently being investigated for corporate manslaughter.
To do with your case?
We don't know. It's to do with some case. I think the parents are going to be contacted with regards to the children that are involved in the investigation. So I think
that gives more context, right? You're coming from a place of, I've got police saying to us this.
Yes,
you've got a conclusion based on all the evidence that you have in those experiences. And I'm not challenging any of those things. I want to make sure that's really clear to you, because I want to know what happened.
It's important for people to challenge and play devil's advocate, because I could be saying anything. So
I'm not even saying anything. I just want to know, genuinely, and I'm not trying to disprove you. I just want to know, then the woman made this, then the woman made that, then this happened, and then now as you start saying, well, in Telford this happened, and I also spoke to the other parents, and I'm like, this is getting worse and worse and worse the more you speak.
It gets worse. It just
the story does the job to tell it's worse without you even telling me anything. You don't even need to tell me. I don't believe them. I think they're lying. I'm like, well, I think obviously everyone else does too. Look at the evidence.
Exactly.
Look at the police being involved in manslaughter.
Exactly. And maybe that would be a better thing, because for me, I'm only seeing it from my perspective. Maybe it'd be better if I try and draw in objective things that anyone can look at and be like.
It's very difficult to do that when we get to the next part of the story.
Yeah.
So the next part of the story obviously goes, Section 47.
Yes.
You're still allowed on the ward.
Yes.
There wasn't a breathing issue. There's no medical evidence that your daughter ever struggled to breathe due to any reason at all.
Due to anything that I did, no, nothing. She had moments of deterioration because she's on a neonatal ward.
Okay, so there were still like moments of, just because she obviously premature. And what I mean by no evidence of difficulty breathing in relation to what was claimed by them.
Yes.
So you delayed treatment, therefore then she struggled to breathe. Yeah. That's not true.
It's not true at all. They've made 2 allegations that I did that. Both of them are false.
So then what happened from then?
So, just to fast forward, they're making allegations. They're saying I'm doing this. Let's skip some of that stuff.
Yeah.
My daughter then starts getting better. My son's better. My son's really getting better. They're on nasal cannula oxygen now. You can discharge.
Gone from
ventilator, CPAP, high flow. Now they're on nasal cannula oxygen.
So realistically, how many weeks is this?
They got to nasal cannula oxygen when they were like, I think 3 months old. So now we're from September, October.
So 25 weeks.
Late November.
25 weeks premature. That is, not
premature.
And then
now they're like.
That's what?
Past term, basically. So I think they were terming like at some point in November.
That's like, realistically, are you thinking at this time, fucking hell, we are blessed from God here?
Yes. Because we're thinking, even though all this, and we're actually saying to each other, like, because there's other babies that pass away on the ward, mate. There's other babies that whilst we're there. So we're thinking, like, mate, we're going through, and I'm saying this to my girl, like, look, we're going through all this. We know they're lying, but look at our babies. They're still here. Everything's fine. We're going to make it. It's okay.
So, like, you're going through, obviously, the clearly turbulent time, because this is a fucking horrible time for you. Babies are born at 25 weeks pregnant.
Yeah.
And then that's enough to deal with.
Yes.
Let alone that.
Let alone false allegations.
And then you look across, and then other parents are losing their children.
Yes.
And you're like, obviously that's horrible for them. Compassionate for that.
Yeah.
But then fucking hell, thank God we've got
Thank God that our children are okay. And we're saying this, and I'm saying, look, we're going to get through this. It's okay. Because the thing is, if you're a parent, and any parent that's been through a social care investigation knows this, if you know you haven't done anything wrong as a good parent, you genuinely just don't think that because you're just thinking in your head, like, I know that I haven't done it. Mate, I'll tell you right now, my daughter, obviously, the conclusion is she ends up passing away, but I've said to the police before, I would be willing for you to formally charge me with doing something to my daughter just so you can look into the case. That's how confident I am that I've not done nothing, my family's not done nothing, and that they are responsible for what happened to my daughter. But I want them to look into it. They don't want it to be looked into. Yeah, we want them to look into it.
From what you're saying so far, I can see why.
Yes.
So sorry for your loss.
Yeah.
So your daughter was getting better. It's now in nasal breathing.
Now
and we're now gone term, so about 3 months old.
Something like that. 3, yeah.
And then what happened from then?
So technically at this time, they could be discharged home because they're on oxygen and the parents can administer oxygen. But because of the allegations that they've made against us, they're saying, whisper, whisper, we don't want them to be discharged because then we would, first of all, their investigation would fall flat. And then we would be in charge of the oxygen with them at home. See you later, we're off. Thanks, that was a terrible time, but now we're gone. They don't want that to happen because social services are involved and they are believing that we're at risk of harm. And what's interesting is there's a letter sent from the matron to social services in December that says, listen, the parents haven't been allowed to be in the room alone. There's a transitional care room. They haven't been allowed to be in the transitional care room alone with the kids. They're on the ward. The parents are fine. They're fine with the oxygen. Everything's fine. Are we allowed to let them in transitional care room? Social services responds to them, and I got this from Subject Access. They respond like, oh, it sounds like you're changing your position. Can you give us a formal letter explaining that you've changed your position? The hospital, instead of doing the formal letter, they kind of try and sit on the fence. Everything's fine now. Everything's fine with the kids. That's it. But they don't say, oh, the allegations before were false, even though it's becoming obvious, like, this doesn't make sense because it's not lining up. The kids are doing fine. Why do you need to deprive the parents from being around the children if they're clearly providing care for them every day and there's no issues with oxygen currently? So at this point, it's becoming clear, like, oh shit, like the parents haven't done anything, but social services are now saying, right, we've got to be involved in this case. Something's gone wrong. Look at all the allegations you made. So the hospital senior managers, they're kind of trying to be like, nothing happened, but they don't want to say it because then it shows that their staff are lying. So they let it be. They let these allegations stay on the table, which means we have to go to court and defend these allegations, right? My kids are ready to be discharged, but they are writing in the notes, which we found out later. They're writing, Adora needs a discharge scan, which is an echo scan for her heart, yeah? And they're writing in the notes, delaying discharge scan, awaiting social services input. So a child...
So wait.
Yes.
You have factual evidence from a report that says they delayed a scan because of social services report that they were waiting, because if they was to, again, I'm assuming, if they were to do the scan, which proved everything was okay, they should be discharging. But then they would have to then use the social services thing to keep you there, which they didn't want to do. So they delayed the scan, which is delaying medical care.
Well, they definitely delayed the scan. The evidence suggests that that's why. I'm assuming, are going to deny that that's why the scan was delayed.
But you have a piece of paper that says, we delayed scan.
It says verbatim, delaying scan, awaiting social services input, awaiting social care.
Well, that could mean two things. That could mean that shorthand, we're delaying the scan, and in the status is awaiting social services. Or it could mean...
to defend that in court. They've written it over 50 times that they're delaying the echo scan.
So was the echo scan in any way relation to then what went on to her heart?
Yes.
Well, that's completely liable. They are completely liable.
Exactly. Which is why they're covering up now, because...
See how that piece of it, you don't need to tell me anything. I'll go, if you were writing down, we delayed scan because of any reason at all, whether justified or not, you delayed scan.
Yes.
So the reason you delayed scan, you delayed medical care. For whatever reason, doesn't matter. You delayed medical care, and now they died because of it.
Yes.
Because of you.
Yes, you would think that
everything you said so far means it's irrelevant almost, because you've already now written down 50 times, we delay medical care, and that caused my daughter to lose her life.
Over 50 times they've written delaying echo scan. They'll write stuff like, Adora needs echo scan on Wednesday.
Should have started with that.
It's hard to tell the story because for me it all plays into each other.
But you come, because you're coming with your bias of, as I said, I believed you from the beginning. I believe you very soon not. But the way in which the story is coming out when you're so emotional with it, and because hey, I just want to establish facts.
Yes.
As you just said there, that's the easiest one you described, because you said, well, this was written down. It could be one or two things. It could mean we delayed the scan, awaiting reports. Like, they're two separate unrelated sentences.
Yeah.
Whether that's true or not. Or they are related sentences. They were delaying the scan because they didn't want to rely on the social services report. Yeah. And the fact they did delay the scan actually went on to cause that.
Yeah. So they delayed the scan for whatever reason. We get to January, and when they finally do the scan, it turns out she has a condition called pulmonary hypertension. Now, if you look up how pulmonary hypertension is treated, the first thing that will come up says early detection. It can be treated more easily when it's detected earlier. They've delayed the scan, I believe, for 2.5 months.
So what you're saying, essentially, is because of how we were treated by them throughout the entire stay at City Hospital, which led to the next set of events, which led to these reports, this Section 47, which led to this, which led to that. They then, for whatever reason, justified to delay the scan.
Yes.
Which went on to be an undiagnosed condition, which could have been prevented by early detection.
Yes, that's a formal allegation.
They are 100% liable, in my opinion, for what you do, because there's no other outcome that's true apart from what you said.
So here's another piece of information. Let
me just play this out a second. I'm interested in it.
Sure.
Because even if what you're saying is everything you said today is bullshit, they still delayed care.
Yeah.
Because of why you can't delay care for what? Because you're apparently risking your damage in the arm. They're allowed to delay the care.
Exactly.
That makes no sense.
That doesn't make sense.
There's no sense. What reason have they given why they delayed care?
We don't know, because they haven't. So when they do you want me to go to that, or do you want me to finish about how she actually passed away? A bit heavy, isn't it?
No, it's not heavy.
I try to be quick.
No. I got all the time, mate. I got all the time. There's no rush for me.
Yeah.
I'm not rushing at all. I'm trying to establish what other reason can they give apart from negligence.
Well, to play devil's advocate, they could say something like, even if we had not delayed the care, this condition could have made her pass away.
That's true. Could have, but also they can't deny just because that is also potentially true. That is true. Doesn't mean it definitely would have solved anything. But they can't disprove that because they delayed care and then she went on to die, that it couldn't and it may not have been resolved, or at least had a chance of being resolved if they'd done something sooner.
The problem is that it hasn't been a proper investigation. There's been no inquiry.
Then we need to investigate.
They refuse to investigate because if
that's convenient.
It's going to open the can of worms. If you look at Article 2 of the Human Rights Act and some of the case law around it, there's case law that suggests that an investigation is required, not simply if you think that someone caused a death, simply if there is a possibility, basically. You only need a possibility that the state could be involved in a death. There must be an inquest, there must be an investigation. They refuse us an inquest.
They can't, I'm just going to loop around again for a single time. There can't be any other outcome. You are right, playing devil's advocate, that it doesn't mean if they detected it early it would have solved anything. No. But they certainly should have been detecting it because they should have done the scan.
Yes, and the case law also suggests that if a death is considered to be natural causes, which is what they're trying to say my daughter's death was, even though there's more to it, it has to be a process that's uninterfered with by human action, by the action of the staff.
Well, it can't be this.
Which can't be, because if you delay the treatment, then that has been. So even if she died of a disease, you still have to do an investigation because there was the involvement of the staff's negligence. Potentially.
Fact. That's not your opinion. That's fact.
That's a fact. But they cover up. Mate.
So again, just against establishing more facts.
Yeah.
Yeah, this is a lot.
Yeah.
Is it common / policy or whatever to scan the heart?
Yes, that's how you treat. They had a query saying there's her heart scan, it looks okay, but there's some areas that they want to have more of a look at. She was generally speaking fine, but they just said, oh no, let's have a bit more look at it. And then they didn't do anything for another 2.5 months.
So they did detect something, wasn't right?
Not something wrong, it's like
abnormal.
A little bit like.
But bear in mind she was born 25 weeks premature.
Yeah.
Then you'd be surely checking everything. It's great.
You should be. They should be doing the echo, especially if they themselves are like, mate, I'm talking about. Imagine it's like, what's the day today? Like
Tuesday the 14th.
Yeah. Imagine it's Tuesday and they're like, on Thursday we got to do an echo scan. They don't do it. Then they write again, on Sunday we got to do an echo scan. They don't do it. Then they write, on Wednesday this is weeks going by. They're like, on this day, they're saying we're doing the scan on this day. So the fact
that went on for 2.5 months.
And they do, sorry?
And that went on for 2.5 months.
That went on for 2.5 months.
And then she dies.
And they go,
well, I'm not sure.
And the way that she died is, when she began to deteriorate, they got, from this condition, presumably, they got another staff member in from a local hospital. And they're like, the staff member literally says, when he comes, he's like, and you can see this in the notes, he's like, right, let's get Adora's echo scan from November that I can look at.
First thing
a fucking echo scan. So he's come in, he's like, where's the record?
So this is after the death?
This is before she died.
So before she dies. So let's go back a step. Tell me how she dies.
Okay, she dies because, I kind of have to get, so they come in, they say, oh, where's the echo scan from November? They don't find it. Next day.
What was the trigger for that? So we're about to be discharged.
Yeah.
Then there's
consultant. Basically, her oxygen starts, she basically starts needing more oxygen, and you would assume that she would start needing less. So she's like
gone to the nasal.
On nasal cannula, and then she's going like, instead of going like, because I think she gets down to 0.1 nasal cannula, which is like almost the lowest. Then she started going up like, oh, she needs 0.3 today. Oh, she needs 0.5 today. All the way up to 1. Oh, she needs 1 today. So
does that work on how much she's pulling air from that nasal
It's
passage?
how much flow they're giving her of nasal cannula.
And they choose that?
So yeah, so it's like liters per minute.
So is that because she's got the ankle detector on? And then she's going down in, and then compensating?
Say she's at 95, with the ankle saturation monitor. 95, it looks like we had to have 0.3 today to keep her in 95 instead of...
So they're reading off this oxygen saturation, and then they're giving her more because
to keep
of that.
The same level.
And it was going the right way, right? Because you're getting, obviously, I'm assuming, more from the ventilator than anything else. And they're then de-escalating down to the CPAP.
Well, she again, her oxygen requirement should be getting lower. Yeah. Instead of getting lower, it's starting to get higher, right?
What I meant, sorry, is it had started off high with ventilation, gone down.
Starts going down.
Then we're stabilised.
Yeah.
And then all of a sudden, out of nowhere, she starts going back up. And there's no trigger, there's no event that happened. She wasn't.
Well, she got left next to a cold window for a bit. We've speculated as to what triggered it.
Pneumonia.
We don't know.
Just something happened.
Something happened, but there's no evidence of infection or anything like that.
Right.
So, but I'm alleging, my allegation based on my analysis is because she had this pulmonary hypertension condition that you're not treating, that's what's causing her to need to work harder to maintain the same oxygen, right?
It makes sense.
That's a theory, that makes sense.
Yeah.
What they've done is when this doctor comes, he sees, we don't have the scan from November. All of a sudden, guess what? They do a COVID test on her and they say, she's got COVID. Exactly, where did that come from? So conveniently, and again, let's not make a formal allegation, but as soon as they realize, we haven't treated this condition for 2.5 months. Now they're saying, she's got COVID. How many cases of COVID do you think there's been with newborns in 2022 in the UK? It's less than 2, mate. 1, 2. So all of a sudden, when you realize you haven't been treated, now it's COVID. That's what they're trying to say. It turns out when we looked at the internal notes from the labs, the lab queried the COVID test and said, we've got 2 tests. The one that you've said is positive, we don't have a record of. So they're basically saying, where the fuck did this test come from?
So we've got COVID, we've got no proof of COVID.
We've got no proof of COVID. It's bizarre. It's bizarre because you would think, based on all this, at least there'd be an investigation.
As soon as there was an allegation of abuse as in they alleged you were abusing, or anyway, risk of harm.
Yes.
They should have been documenting the shit out of everything properly.
Yeah.
And then haven't got any proof of your negligence. Just lots of proof of their weird stuff.
Yes.
That we're unsure, but obviously you've got a conclusion that clearly from other hospitals and other parents, this looks like it's a common pattern, not just us.
Yes.
Which then concludes that every time there's an issue, there's another thing claimed. Medical notes seem to be not there anymore.
Or they're saying we've conveniently done something. So they do a medical procedure without our consent. The next day, I've done something. They realize that they haven't treated pulmonary hypertension. The next day it's COVID. It's never there actually.
Is it literally the next day?
I think it's like a day or 2 later. They're saying like, she's got COVID.
If you had like a little timeline of like event that happened,
I've got a timeline.
And then like the next day,
if you see the notes that I have, it's like, that's why when I say events and you're like, well, okay, how's that relevant? Because I want the key facts of the event. When you see how everything ties in, you understand why even the little things are relevant. Because it's like later on when they're saying their narrative, it's like they're saying, dad was aggressive. But on the 12th of this day, you said that there's a recording of you saying, I've been with dad and nothing's wrong. So that's where everything plays into each other. So in my mind, when I have nightmares, which I have nightmares pretty much every night, I'm thinking, no one's going to believe me. No one's going to believe me. No one's going to believe me. So I'm trying to, that's why every time I tell the story, I'm trying to give every detail. I'm trying to help people to see this, that, and the third. I'm trying to explain like, this is who's done it. These are the culprits. These are my abusers, basically. And I feel as though if people believe me, I would get justice for my daughter. Because I haven't had justice for my daughter, I still feel like I'm fighting for basic level of being believed and understood. So it may come off as defensive, but it's actually, imagine, mate, again, the COVID,
I believe you,
etc. Thank you. We've had no inquest, mate. So there's been no inquest,
madness,
no investigation, no multi-agency review.
Fucking madness.
No serious incident investigation. There's an event that actually does kill my daughter off.
But yet, when they make a claim that's false under Section 47, they have a meeting straight away.
Exactly.
But then your daughter does die and there's no meeting.
Yes, because you would think, and here's another weird thing. Okay, imagine, let's assume, for argument's sake, I've done something that's delayed my daughter's treatment. You've got this is repeatedly documented, right? Then you're saying this child passed away from COVID and you're saying, oh, we didn't wear the mask or whatever. They've written other stuff about. Okay, let's investigate then. Investigate. If I've done something, why don't you want to have an inquest and see what I've done? You understand?
Well, yeah, if you stole my bike, I'd be like, get the camera straight away.
Yeah,
if I knew you hadn't stolen my bike, I'd be like, don't watch cameras.
Let's investigate everything.
Yeah.
Investigate me, investigate you, we'll see what happens. But you can tell who wants transparency and who doesn't, because their positions is all, don't investigate, don't look into it, don't review it, don't release the notes for years and years and years.
That's crazy.
If I've done something that you've accused me, why don't you want to investigate it?
It should be this back to this. My point about this independent.
Yeah.
Surely, as soon as an infant dies after
a Section 47, you'd think they'd be right in there. Oh, what the fuck's happened here? Do you know what I mean?
Well, I didn't even think. I wasn't even going to say that. That's even yours is even better than my thought. Yeah. I thought after a baby dies after being born that early, we should investigate what happened.
Yeah, because she died at 5 months old as well. So she's not died like a newborn. That's a long time crazy. In their care.
So like you even like you do the miscarriage, then the birth, then the newborn, the prenatal.
Yeah. And then we've had to go to court.
But you've now got to 5 months old.
5 months, so she's a baby.
They've taken your daughter from the negligence. They killed her.
Yeah.
Like this is not like newborn baby, premature. Then there were some issues and died.
No, this is
like the baby made it through all of that.
And then they killed her. Yeah.
And then their actions led to the death of
the daughter. And the way that she died, so when they realized she had pulmonary hypertension, they started saying she had COVID. We did a letter to the hospital saying, listen, we're urgent and desperate, we're being abused, they're lying, they've done medical procedures without consent. All the stuff I've told you. We've basically done a formal complaint to the CEO. The CEO sends this woman to come and have a meeting with us and they're saying, right, we're going to move you hospital because we can see that this is urgent. But we didn't end up getting moved hospital. On the day we were meant to move hospital, that's when they also said she's got COVID, she needs to isolate. So we couldn't move hospital. She isolates for 10 days. I think she isolated until the 16th of September or something. They then, so she's considered, or maybe a bit earlier than that, but then she's considered COVID negative. She had no symptoms of COVID anyway.
And no positive test.
They had a positive test 10 days ago, but it's a really dubious test. Like the lab queried it, and even the people in the other external consultants were like, we don't think her deterioration is because of COVID. They're saying
but she did have COVID or she didn't, because we also have this different test number.
I personally don't believe she had COVID, but that's my personal belief.
So what happened with this COVID test that didn't match the number of the test?
They sent the COVID test to the lab, and then the lab basically said, we've received 2 tests. One of them, we don't know where it came from, and it's positive, and the other one is a negative. That's basically what they said.
That's fucking mental.
That's mental, isn't it?
Even after, again, forget everything else you said today, just that thing would cause an investigation.
Exactly. But this is because the cover, I honestly think, and any parent that lost a child, I think this is one of the worst miscarriages of justice in UK history. Because maybe obviously not like a serial murder or something, but and you can say, well, children.
But the succession of errors here.
Succession of errors, yeah.
There's enough in one of the comments you've read to be significantly serious.
Yeah.
And there's 17 of them.
And there's more. Because when they said, oh, she had COVID, when they realized that they hadn't done the echo scan, 18th January, they finally do the echo scan and they say, oh shit, she's got pulmonary hypertension, right? They say, oh, what we're going to do is we're going to put her on the ventilator, because they had put her back on the ventilator multiple times. We found out later that earlier on, they had put her back on the ventilator and they'd collapsed her lung and they didn't tell us. So this is another thing. They've actually collapsed her lung early in her care and they didn't tell us. So when we were saying, something's not right with her daughter, we think it's a ventilator, they had actually collapsed her lung, not at birth, but just a bit after birth, and they didn't tell us, right? So when they were going to put her back on the ventilator on the 18th, we're saying to them, guys, I don't think this is the care. Because first they said, what we're going to do is treat her with sildenafil. They're called nitrates. That's how one of the ways to treat pulmonary hypertension. And you don't need to put them on a ventilator. I'm saying to the nurses, guys, I don't think you should put her on a ventilator. She's been harmed multiple times by this. You've covered it up. And the nurses actually agreed with me. A nurse and the doctor said, you know what, Amma, I think you're right. I don't think we're going to put her on a ventilator. They were going to put her on. They changed their mind because of what I said. They then took it to the consultant. The consultant overrode them and said, put her on the ventilator. When they put her on the ventilator, they put her on with the wrong size tube, collapsed the same area of her lung, right up and over her lung, yeah? Now she's on the ventilator with a collapsed lung.
Those are two separate issues that combine to a fuck up of a magnitude, because the overriding decision is one issue. Then just being rubbish at putting the ventilator in and using the wrong one.
And not using, remember, the difficult airway pathway for neonates? They did.
So now that's three issues in one of the events.
Yes.
It's got three major errors.
Yes.
They overrated the decision. Then they didn't consult the airway practice that you spoke about, and they used the wrong fucking size.
Yes, and they collapsed the right upper lobe of her lung. Then she's on the ventilator, 18th, she's improving a little bit, her lung is still collapsed. They're telling us, oh, the lung's going to recover. It never recovers. This is very important. 23rd, I'm at my daughter's hospital bedside for like a day or two straight, not even showering. I'm like, right, I need to go shower, fucking sort out things for my family. I tell my girl, look, I'm going to go do the laundry. I'm going to come back. I go home, my girl starts calling me, I'm coming back, her oxygen's desaturated. She's texting me 80, 70, 60, 50. I speed to the hospital. I did 70 in a 30, almost crashed. I had a mental breakdown while I was driving. I got a speeding ticket that day, got my license, took and everything from that, because I was doing 70 down, like towards Nottingham City Hospital. I'm speeding, mate, because I'm thinking, this is it. I get to the hospital, I'm having a mental breakdown. My daughter's oxygen's on 0, right? They managed to resuscitate her. They're fiddling in the machine. Something's gone wrong. They resuscitate her. My girl tells me that what happened was there was an alarm on the thing ringing, different from the normal alarm, that said like flow sensor error, pressure's not being achieved. So it's cut off the breaths on the ventilator because it's saying there's something wrong with the ventilator circuit. It's cut off the breaths, and my daughter's deteriorating over time and collapses to 0, right? This event happens. I have a mental breakdown, screaming. The consultant comes, they fix the machine. They tell us, look, something went wrong. This is going to be investigated, yeah? 2 days later, and this event collapsed my daughter's lung in multiple places. Excuse me. In multiple places. 2 days later, my daughter dies. They're saying we're saying this event killed her. They're saying this event is going to be investigated, don't worry. I've later found out, investigation shut down. They're supposed to do something called a serious incident investigation when that happens. They've shut down the investigation. Before you do a serious incident investigation, it's meant to go to a panel that decides, is there going to be a serious incident investigation? The notes say they shut it down before it got to the panel. So the process is you take it to a panel to decide. You've decided before it gets to the panel not to do an investigation. No serious incident investigation. They've sent, what they've sent to the coroner is, my daughter had COVID, she deteriorated, died because of COVID, pulmonary hypertension, pulmonary hypertensive crisis. Complete lie. They've also put in the formal documentation to the coroner about 50 false allegations against me, trying to implicate me as the cause of my child's own death, saying, oh, I tried to take her oxygen off, that I'm a domestic abuser, I'm aggressive, intimidate. All lies, all things that did not happen, or things that have been misrepresented, plus more lies that this woman decided to add on for whatever reason, because she's going to be a defendant in the case too, right? I don't know why she's added on, that I tried to remove my daughter's body from the ward after she died. All these things are just complete lies, trying to desecrate my daughter's memory and destroy our credibility. The coroner even says to them, don't let me go to court, because we still had to go to family court, remember? Don't let me go to court because I'm a risk to the staff. So tell me why the coroner is involved in the decision about whether I go to family court. You understand? The coroner telling the hospital, don't let me go to family court. Where's the connection?
Did you have care of your son at this time?
So they didn't come home. They was on the ward this whole time. My son got discharged like a day after my daughter died. As soon as they killed her, right, get him off the ward now. So after they killed my daughter, my son got discharged, and because of the family care investigation, they did something called an interim care order, where before they determine the facts of the case, like, right, we need to do a plan in the meantime. So my son was staying at my mom's house, right? So, and I had to do visitation. I had to do I think 3 times a week I was allowed to visit. So you just killed my daughter. I'm not even allowed to be around my son. I'm having to go and visit him 3 times a week. After they've done all this to me, mate, this is what they didn't do. Then they cover up my daughter's death. They issue this document to the coroner saying, oh, it wasn't us, it was all lies, trying to defame us. The coroner rules no inquest, no investigation, no inquest. Yeah?
If me and you went to hospital now,
yeah,
and they put a ventilator in us for whatever reason we were unable to breathe,
yeah,
and they punctured our lung and we died,
yeah,
there'd be an inquest immediately.
100%.
Just that one event.
Yeah.
That's fucking mental.
Yeah.
That's
and the pediatrician that has made a decision about whether my daughter is to have an inquest is a former, the coroner is a former pediatrician for that hospital.
Also part of that team?
Not part of the team. She works on that.
That person's sister, though, is right? The one.
You do the maths, she's worked on that ward before. So my daughter dies, no investigation.
Do we know if that person knows those people or used to work with those people?
I'll put it this way. The people that are involved in my daughter's care have worked on that ward for 10 plus years, a lot of them. So do the maths.
That's insane. These people are still at work.
Still at work.
And they're not suspended. No one's been suspended.
No suspension, no investigation.
But you're not allowed to see your son at the time.
And then they banned me from the hospital and said, I'm this, that, and the third, I'm terrible. They banned me from the hospital. All they're trying to do now is damage control, destroy my character to make it look like we were the ones at fault. But obviously, as you can see, let's assume I'm the worst person in the world. Okay, investigate it. But
even if you're the worst person in the world, you being the worst person in the world has got nothing to do with that.
Whether you kill my daughter or not. And then the crazy thing is, so no inquest. We've asked for multi-agency reviews from the council. The council's done no investigation, no serious incident investigation, because there's something called a child safeguarding practice review, where if a child dies that you are doing a Section 47 on, you're supposed to do a review of that care. No review, right? They've done something called a child death review, yeah? The child death review meeting process is supposed to involve the parents. They've committed fraud on the document and said, we asked the parents to be part of the child death review and they refused.
Oh, come off it.
They've lied and said...
But then you're now this bothered about it now, but you weren't bothered about the report. We've
been fighting for 3 years straight. I've probably sent 5,000 emails. I've emailed, there's people that may watch this that will say that if you go on my online platforms, I think I've got 500 people to email them, something like that. I'm getting members of the public to email them. I'm getting advocacy groups. I'm doing all this. I'm issuing them letter before action. I'm sending them evidence, and the police are complicit. When you do a multi-agency social care referral, the police sign off on it and say, yeah. And the problem is, again, not to accuse people that they may not have malicious intent, but imagine they've all signed off on a document that says, we're going to do a Section 47 based on you causing this delay to treatment. The delay didn't happen. There wasn't a delay.
But when you say complicit, what you're saying is essentially, the moment you sign your name to a document,
yes,
you are essentially saying that you are agreeing, in this case, with that thing.
Yes.
And without any information, or enough information, clearly because the information was wrong, no check-in, they're willing to put you as the bad guy immediately on Section 47.
Yeah.
And then when your daughter goes on to die from clearly at least 3 issues in one of the events, let alone the rest.
Yeah.
There's no investigation.
Yeah.
Your parents signed off to not be involved.
Yes.
Well, that makes no logical sense.
They've committed, mate, the amount of fraud. We actually caught a staff member red-handed trying to frame us. We've got a 2-hour-long recording of us dealing with this individual. You can tell the time of the recording and everything. Technology is pretty good now. You can say when this recording was made and everything. This woman's documented. Dad didn't want antibiotics. He was aggressive. That there was a 2-hour delay to treatment due to significant resistance. Mate, I will send you the recording. You tell me what you think. You can literally...
And so you've got the recording.
Hi, how are you doing? I've got the full recording.
Which tells us a clear story.
Clear story.
And then you've got a report or notes that claim completely different to the same event.
And then she got caught by her own staff. She got caught by the management. And we're telling the management, you realise we've got that recorded, right? You know you don't fucked up, right? We've got you recorded now, basically. And they've written, it was a mistake. They've said, we apologise to the parents that this note was a mistake. She's detailed paragraph. Dad delayed the treatment. He didn't want the antibiotics. He didn't want this. Guess who she was working with? Family care team. So they're now trying to...
no one's investigating.
No one's investigating. Well, the NMC, I'll give credit where credit's due. The NMC...
NMC, who are they?
Nursing and Midwifery Council. I think they're going to... I don't know for certain, but I think they're going to crack down on these people.
So when was this?
This was between September 2022 and my daughter died January 2023. And then the battle's just been going on and on and on because the cover-up has been pretty much even worse than the things that they've done. When we got the medical notes, they've deleted all the key medical notes from the 18th, from the 23rd. They wouldn't give us information. They wouldn't respond to our subject access requests. They're lying about us to the coroner. They're telling the CQC that the alarm that was ringing that when that error happened with the ventilator, saying that's one of the normal alarms and that the parents don't understand how the normal alarms work. No, we're saying, no, this is a different alarm. And mate, I've found the ventilator manual for the ventilator my daughter was on, And the alarm that was ringing is listed under a section called high priority alarms. High priority alarms are alarms that require immediate staff intervention.
But what they're trying to say, essentially, is a really random analogy. I fell off a crane because I did this thing wrong, but I wore my seatbelt in the car on the way to work. Fuck's that got to do with anything?
Yeah, exactly.
What the fuck has that got to do with anything?
They're like, they're like saying to them like, oh, the parents are saying the ventilator wasn't functioning properly. They're playing like semantic games. It's like, we're not saying that the ventilator itself was broken. We're saying it was in an error state that it's designed to go into when something's wrong. But they're like, oh, so you're saying the ventilator's not working? No, the ventilator itself works. That's why it's able to put itself in an error state to tell you something's fucking wrong. Do you get it?
I totally understand.
Do you understand?
But it still makes no difference to what ended up happening. But that's just semantics of like, oh, it's blue, it's red,
exactly.
It's green. Die.
Let's investigate, shall we? Do you know?
Yeah.
Let's get to the bottom. You'd think they'd be like, but with, and my daughter's name's Adora Maduako. With our case, it's like we have just not had any level of sympathy, empathy. I mean, when my daughter died, they literally rolled my daughter's dead body towards us, right? Gave us the dead body. Woman just looked at me and just walked off. Didn't say, sorry, condolences, nothing. She just gave me my daughter's dead body and just gone, right, off I go. Just walked off. It's like they view us as less than human or something. So people, when I talk to black people about this, they're like, oh yeah, that's fucking racist. What? Do you know what I mean? But I try to be impartial. People hate it sometimes. I don't know if it's a race thing. I don't know if it's, do you know what I mean?
I'm not black, so I'm definitely in the privileged camp of being white.
So they say.
So they say.
I think privilege is being black, mate.
Well, I don't mean that like that. I mean, the reason I say that is because I remember saying to someone, or a black friend of mine, like, is that the case? Is this still the case? He was like, mate. And he's like he's a super tough MMA fighter, actually.
Yeah.
And he went and tell me stories that blew my fucking mind.
Yeah.
I was like, you think it doesn't exist? No, I didn't say it didn't. He said, this is what happens still to me daily.
Yeah.
And I was like, I couldn't fucking believe how his life, how the situation he told me, that I know he wasn't fucking manufacturing. Yeah. I couldn't fucking believe it.
Mate, I used to myself be like, race is not a big deal, until this happened. This shit opened my eyes. Because what I realized, like, when I was younger, I played like video games and people be like, oh, you fucking nigga. And I was like, oh, whatever, like online people. And then as I've got older, so I mean, like, I literally just was letting this go over my head. I'm like, this ain't normal. So it's
almost like desensitized.
Yeah, and then stuff starts coming back to me from my youth. Like one of my first best friends ever, little Greek boy, is like, my mum said I can't hang around with you because you're black. And I didn't even know what race was then. I'm like, what? But it's all gone over my head. Like, it's only when I'm seeing this and I'm like, oh shit. Like, and like, even to this day, because I do a lot of like stuff on TikTok trying to like expose what's happened with my daughter, I get people literally messaging me, be like, yeah, I'm glad your little black baby's dead. I'm not even joking with you, mate. Like, people online, and everyone gets online hate, but like, I didn't realize the extent to which some people genuinely like fucking hate. I didn't know, mate.
Yeah.
I honestly didn't know.
People seem to hate everyone, really. But then as soon as they put that distinction.
No, it's not everyone, no way.
But you know what I mean by that is people just like, oh, you bald gun, or you Polish gun, or you this gun, or you that gun.
Yeah.
But then when you are black and someone saying you black, whatever the fuck they say.
I don't care about someone saying you're black. It's more like, okay, say I would say that we've been victimized, by the system,
Do you think race plays a part in how you've been treated in this case?
See, this is what I'm saying. I didn't think so, but it's how the more I think about it, the more I'm like, I think it actually did, because if you think about it, right? Let's do it from a man to woman perspective. If you cry and a woman cries, who do you think is going to get more sympathy? The woman, yeah?
No one gives a fuck.
That don't mean that everyone hates men. It just means there's certain scenarios where people are going to have more sympathy. So there's certain scenarios where if I'm saying I'm a victim of something and someone else saying they're a victim, there are people that will look at me like, oh, fucking black guy playing the victim. That does happen. People do play the victim. But when you actually are the victim, that stereotype of, oh, you're playing the victim, it makes it harder for people to believe you because they think, oh, I fucking must have done something. I've seen you guys can be aggressive. So that stereotype, when you actually are victimized, that's when it plays against you. Do you get it?
I totally understand.
Yeah.
Let me ask you this.
Yeah.
Do you believe if it had been me, who's white British male, at City Hospital, do you think I'd have been treated the same as you were?
I think it depends. Because you're like kind of a bigger guy and you got tattoos, I think they still would have be able to do the same plays on you, to be honest. I think It maybe, I think honestly, if I was a woman, I think I would have been treated different. But because I'm like, I've got multiple things where it's like, I've got tattoos, I'm a bit of a bigger guy, my voice is quite loud and deep. I think a lot of things play into it, not just race. And I think there's other parents who have had similar experiences that are white British, white female. So I don't think you can just put it on one thing.
But like there's a combination of pieces that lead to them. If they, almost like, it's like school, if they don't like you,
then it comes, yeah.
They don't like you.
My theory is whoever you are, you're going to have something that plays against you. So if you're like, let's say you're a lower class white guy, I'd say I'm more of a middle class black guy kind of thing, yeah, from my schooling background and stuff. There's certain things where people are going to be biased towards me because I'm more of a middle class. I could speak well, do you know what I'm saying?
Intelligent.
So
the threat is intelligence. You also, as soon as you start questioning them,
possibly.
As soon as you come, obviously I know you've been in a massive investigation. As soon as you start talking about this claim, this study, that study, I'm like, guy knows.
I know I'm on about me, but I'm saying like there's certain situations where I have more privilege than other people, and I'm not saying it's about a competition hierarchy of privilege. It's not that. It's just, okay, say if you're disabled, mate. If you're fucking disabled, you're going to be treated different. Say if you're on a date with a girl and she rocks up in a wheelchair, she's going to be treated different from a girl that's not in a wheelchair. That's just fact.
That's just fact.
That's just
people
facts.
who say it didn't happen,
it's just facts, bro.
Yeah.
If I'm fucking 6'10", people are going to treat me different from if I was fucking 5'2". It's just facts. So to think that
it's when they deny that. It's when they deny that and say, no, I treat you the same. Like
everyone treats everyone.
Because like whether you look, like you said, I'm a muscly guy. Also, when I went to A&E, the way I arrived to A&E was not like everyone else arrived to A&E. It wasn't in an ambulance. It was way dickish more than that. Like the car I have is ridiculous. And so we rolled up outside A&E. So I think people treat you differently as soon as they think you got some money. They think shit,
probably, yeah,
access to something, lawyers, problem, treat them different. And
that compounds a little bit the racial thing because you also kind of perceived some people, not you, not me, not like normal people, we're from cities and that, there are people who they go to really like private schools and stuff. So their perception of sometimes people like me is they just think, right, he's probably poor. Like they have a perception, even if you're well spoken, they think you're more likely to not be able to advocate. So I think they've even been surprised, the hospital has even been surprised, like, fucking hell, how's he pulled this off? Because when I was on the ward, see me now, like, you might think, okay, it looks fine. When I was on the ward, I'm there with a fucking hat turned to the side, tracksuit bottoms. So they're thinking like, fucking riffraff, do you know what I'm saying? Yeah. It's only when they've realised, like, fucking hell, he's kind of knows what he's on about now. That's when they start like covering up more.
It's the same NHS criminal justice. There's a massive similarity to what you're talking about here, to what I've been through myself. Yeah. Very different. But then what you're saying, I completely understand in a way as close as I could understand without going through what you've been through. Yeah. Because people do treat you differently based on all the facts you said: colour, race, size, gender, status, as in class.
100%.
Because as soon as they think you have something that can threaten them in any way, shape, or form, and not then conform, then these things start to happen.
I think class is the worst one, mate. You know that there's a woman who, because there's a lot of us maternity like harmed families and stuff. There's a woman, and someone told me, said, listen, don't tell her I said this. She said there's a woman that she lost a baby on the ward. She has a look to her where she kind of looks like, maybe she's had a bit of a hard life and that. And they said that this woman was telling them, this something's wrong with my baby, something's wrong with my baby. And they said that they just dismissed her because of how she looks, because she looks like maybe she's had substance abuse. But apparently she didn't have no substance abuse issues, nothing like that. They said because of how she looks, the hospital just ignored her. And then the baby died.
Why would you work in hospital and then judge people for what they look like?
We all judge people, mate. It's human.
We do judge people. Sorry, you're right. We do judge people, but I would judge. I'd make an assumption based on what you look like, where you came from, what your life might be like, who you might be like, what kind of interest you have. Yeah. But I would not then not treat you because of my conclusion.
It's the culture in these hospitals. I think a lot of them, and this is me trying to be empathetic, right? Even the people that have harmed me, because I feel that I have the ability to forgive because of how I was raised by my parents. Even someone else, I genuinely think I have it within my heart. Not right now, but one day. And the truth is, I think a lot of these staff, I think they're traumatized. I think they need to get psychological help because I think that they deal with death of children. Sometimes they deal with patient abuse. They deal with really tricky situations. And I think to try to protect themselves and become immune from what they go through, they become bullies. They become desensitized to human suffering. And it makes them lose empathy for other people. And they start thinking about protecting themselves. they think about how to remain in the hierarchy of their organization to the detriment of others. And some of these people in these organizations, some of them are psychopaths, and they manipulate other people and bully them to make those people get in line. And you get a lot of, there's a woman called Victoria Rickson. She does a lot of online press and stuff. I've actually done a couple of lives with her, spoke to her a few times. Like, nice woman, right? But she's a former maternity ward sister. I mean, she's come out, she was on James English, and she's come out with a lot of stuff, mate. And she's saying, like, basically that, yeah, that they become evil. She's saying that, she said her James English episode is entitled NHS is a cult. It's not me saying this is her. And she was there for like 10 years, because she says that what happens is the policy, it seeps into your skin. It starts becoming who you are. You start losing who you are, how you think yourself, and you just think NHS policy, NHS policy. She says that what happens is when you want to whistleblow, when you want to speak out, the consultants and stuff, they'll close in on you. I know NHS whistleblowers, they've whistleblown about patient harm. All of a sudden, their NMC pin's getting taken. They're being accused of stealing medication. There is like, mate, this sounds fucking crazy to say. There is like a healthcare mafia in the UK. There really is, mate. It's underneath it's behind the scenes, but there's mafias in, same with anything, police, fucking court, anywhere there's human beings. People.
I do agree with you from what I've heard from you today, and then obviously with the different families and the other hospitals.
Yeah.
There seems too much evidence from what you've said.
Yeah.
To not investigate not only your daughter's death, but this entire problem. Because if what you're saying is true, and it does go across the entire NHS, how many other families will or have already lost children because of this culture?
There's thousands of us, mate. There's so many. I know a woman, 60 years old, she's, bless her, she told me that the NHS killed her daughter about 20 years ago. She said since then she hasn't been able to leave the house. And she says when she sees me like trying to advocate for my daughter, she says that she wishes that she had fought as well, because she kind of let them get away. Well, she didn't let them, but she said like back then it was harder for her to like sue, and she kind of let it slide a little bit. She said it's ruined her life. She says she can't leave her house. She says when she goes places, she has to call up her son and say, you know, can you come out with me and stuff?
Wow.
Because literally they ruin people's lives, and we become just these forgotten people walking around who, you look at us, we look fine, but behind here, mate, there's fucking something ready to blow. Because man, it's just given me, maybe it's all for a reason, innit? It's given me so much more understanding of why people do heinous things, why people give up. You know, some of these people you see, you probably know people that go in prison and stuff like that, and you think, why the fuck would you do? Why would you throw everything away? Mate, you're in a living hell in your own mind, and you're walking around acting like you're normal. At any moment, you're just fucking ready to snap, because every day I have to wake up and think, fucking hell, my daughter's dead. And I think, fucking hell, they're covering it up. Fucking hell, they tried to frame me. Fucking hell, the people, I go around society and I'm seeing signs, we love the NHS. I'm like, they fucking killed my daughter and covered it up. I'm talking to people, they're like, why are you saying horrible things about the NHS? I'm like, you get treated as if you're the bad guy. And I'm like, they fucking destroyed my life. And there's so many of us, mate.
You just said there must be a reason for it. What reason do you have, or do you tell yourself for why the NHS killed your daughter and then covered it up?
I don't think they killed her on purpose. I think that they, if I want to go deep with it, I think that they are scared of the unknown. They're scared of people who suggest things that they may not know, in terms of like, imagine you've been working with a machine for 10 years and someone says, mate, I think there's something wrong with this machine. I think you're now thinking, fuck, have I fucking been using a machine that's been harming people? Have I been doing it wrong? And they're scared of that thought. So they try and protect themselves. And I think when things go wrong, they're scared of looking themselves in the mirror and saying, I made a mistake that killed a child. It's hard, man. It's hard. None of us want to admit it. You think I want to, even me, I don't even like the thought of, mate, do you know what? If I wasn't rude to that staff member, maybe she wouldn't have started abusing us. I have to think about that. But at least I can tell myself, mate, I know I did everything I could for my kids. I can sleep at night with that. But imagine you've accidentally killed a child, mate. That's going to be hard. You're going to be attacking whoever's bringing it up, trying to defend yourself. But then if you want me to take it to like maybe like a spiritual kind of place, I think that, so my daughter's name, it means like firstborn, basically means like firstborn daughter in my language. And her middle names, they mean like It means that basically they're like God brings peace. Basically, that's basically what her middle names mean. But there's another meaning of her name, which means that God brings things to completion. So when I think about her story, about like how I named her in the womb and like how everything happened, and then the fact that my son went through a lot of the same things, and then he survived and he's here and he's thriving. Sometimes I just think, brother, it's part of the divine plan. It's just like God gives and then God takes away. If you believe in God or whatever, I'm not religious, but like whatever the force is, like the universe, it's like trying to teach me something, I guess, or teach us or teach my son something. Like you get a gift and then sometimes you get a curse. That's how this world is, I guess.
The name's beautiful. It's also very close to my own heart. My daughter's middle name is Nala, which means gift from God in Swahili.
Okay, nice.
So we'll follow the same track.
Yeah, nice.
There's also something else you said in the research.
Yeah.
About the daughter's tissue sample got sent to London's genetic testing facility and it got destroyed.
Well, they're saying that they got damaged and they're beyond repair or something. They got damaged in a way that they can't.
There's many random scenarios in this case where there's just missing details.
Coincidences.
Lots. COVID tests that just, there's two, we're not sure.
Yeah.
Or that's gone, or this is gone.
Tissue samples missing. The medical, if you see the medical notes, mate, we've done free subject access for the medical notes. Every single time we've seen them is different. This one's got the stuff missing. This one's got the stuff missing from this, but other stuff missing. It's a shambles, mate. It's a shambles.
What's next for Ama?
So I do a lot of online like stuff now. I'm trying to build up my online platform. So I got my the page that I do, which is about advocacy for my daughter, which I do other little things on, which is my TikTok, which is Adoras _ story. So ADAORAS _ story. So Adora story. You can hear videos about stuff that happened with my daughter. And then I've just started like a YouTube platform, which is called State of Deception, which is all one word. And I talk about on that like issues of health and social care. I talk about corruption, fraud, but I talk about stuff in America, stuff in the UK. Because the concept behind it is I think we're all living in like, so a lot of us live in like a delusional reality where like you got people that, I'll tell my story, like, oh, that couldn't happen. You got people that, you know, things happen with COVID and they're like, they believe in one thing and some people believe in another thing. Like, so a lot of us, we're just living in like, in a fake reality of our own creation.
From what I've told you obviously already, I've written a book that's not released yet for legal reasons also.
Okay.
And when people hear that, they'll go, there's no way that happened like that. No way.
Truth is stranger than fiction. I'm writing a book as well about my daughter's case. And then we're suing, obviously. So we're suing. I want to do private criminal prosecutions. It's all going to be difficult. And then we really just want a lawyer. So a lot of this, in fact, this interview really is because I'm trying to reach out. I want to get some of the best lawyers in the country. If I can reach them to look into our case, I want medical experts to do case reviews. Kind of like with the Lucy Letby case, because I talk about that case a lot, where I want people to scrutinize everything. I want all of my daughter's case details out in the public so people can look and see what I'm seeing. Because I think this can be groundbreaking around cover-up culture, patient care, premature kids, you know, even twin studies. There's a woman that I know, she does research into like twin studies, and she's saying that there's dodgy things that go on in the NHS with twins, and it's just if you take away the trauma, the harm, this is obviously the worst thing that's ever happened to me. Take all that away, it's still fertile land for us to develop as humanity, to look at something like this and think, right, how do we fucking grow from this? Because this is painful, you know what I mean? But there's got to be something in it that we can take out of this as a society. I just want my daughter's story to mean something and not be like it don't matter, how they're trying to make it seem like it doesn't matter. It matters to us, mate. Like every day, mate. Every day is trauma, every day. And I've got other kids, and if it weren't for this, mate, my life would be fucking amazing. My kids are fucking amazing, bro. Amazing, bro. My family's amazing, bro. Like, I've got nieces, nephews, fucking, mate, amazing. But and that's what keeps me going. But like, we still got the trauma. It's hard to talk to people about it. It's hard to get mental health support in the UK. Obviously, I was working in medical sales at the time, and I have a good educational background because obviously I've got my degree. I've done like internships with like some of the top pharmaceutical companies in the world. I've got like qualifications with like pharmacy service skills. Then I've got a bit of history working in medical sales and stuff. So what I wanted to do before all this happened was I wanted to work in medical sales, move up into medical liaison, and I had this goal that I wanted to write a book on pharmaceutical marketing. I don't want to be anything near anything pharmaceutical anymore. I don't want to be in medical sales, medical fucking shoe shine. I don't want to be nothing near none of it. So that's destroyed my career basically, because now I have to look at life differently and I have to navigate the world with trauma. So I have to watch for my triggers. I can't be near doctors and hospitals and stuff because that will trigger me. I can't do anything. Medical sales, one of the most lucrative forms is surgical sales. You can sell in surgical equipment. They have to go onto the wards. Sometimes they would go on a neonatal ward, go on a hospital ward and seeing someone in surgery. I can't do that, mate. So it's fucked up my career. Like I can't do, and that was really, I'm not just saying, that was really a dream career for me. I had it all planned out. But now I thought, okay, maybe with all of the information I have, maybe I could go into like study law or something. I think about it, but.
I think you're an incredible speaker.
I appreciate that.
I think there's way more that you don't realise.
Well,
like what are you doing with the YouTube channel?
So I got a setup where I go live on TikTok, and then people come and like speak to me on TikTok, like debates, all kinds of stuff. It's quite interesting. But then I stream it also on YouTube. Then when I get the YouTube clip, I chop it up into clips. So I've got this little thing going now. So, and I talk about, mate, capitalism, socialism, health, America, healthcare. I just love it. Like, sometimes I trigger people, but I just like I like being challenged. I like having the conversations. So
you do that from home?
Sorry?
Do that from home?
Yeah, I do that I have like a little space where I do like all my little things. And then I really want to write a book where all of my work and my analysis, I want to write a book. I want to probably call it a Dora story. Or when we first started documenting everything on the ward, the chronology that we made, I wrote this on 16th September 2022, documenting the systemic culture of abuse in Nottingham City Hospital. That's what I wrote. That's before all of this. So yeah, I fucking got a story about systemic abuse. You know what I mean? My phone, when I was growing after secondary, I was a bit popular in school, but then things happened. I started getting wrong crowds maybe, and then after like uni and stuff, I've just kind of gone, fuck it, I've gone off social media, just gone focus on my family. Mate, my phone, every day I'm getting calls from like harm parents, NHS whistleblowers. So sometimes people accuse me, they're like, oh, you're biased. And I'm like, I think to myself, right, first accept it. Am I biased? I look into it and I'm like, mate, I have a perspective that I fucking know I've got the nurses, I've got the doctors, I've got the security staff. They contact me on TikTok. They're like, mate, I work in security at the hospital. I just saw this. So social media is brilliant because it's like, it lets you build like a network of people. So you start getting information. So when I say things, I know a lot of the shit I'm saying because I'm like, fucking hell, like I know the fucking manager there. But I don't say, oh, wow, the manager told me. I'm just like, this is what's happening. And people are like, you don't know. And I'm like, fucking hell, I know the manager. You know what I mean? Like, he fucking wistleblowers. He's like, don't tell anyone. This is what's going on in my ward. So like, yeah, I probably could get people on, do interviews. most of them have agreed already, yeah.
I'm really sorry this happened for you.
Yeah.
You speak really well about everything, to be honest. You really, the way you come across, just certainly at the end there, about who you actually are without this story. Your background, your medical history, your education, what you've lost because of it all, not just the stuff that's obvious what you've lost.
And what's even crazy is my mum, for my mum's whole career, she was like a senior manager in the NHS.
Wow.
Yeah, and she used to come back. I used to be it's only started sinking in now. She used to come back and be like, I'm being bullied at work, or my mum's not someone you can bully, but like she'd say like, my manager's being, and I'd think to myself, fucking hell, mum, like that's the second workplace you've been at. I'm thinking, is it you? And now I understand that, oh my God, there really is like a culture of bullying, abuse. Like they really, like a lot of it, it's hard to say this because of how much we've been harmed, but a lot of these NHS, they're victims themselves, mate. They're being victimized by the system. They need to take time, take breaks, look at themselves and go, am I contributing to a system of harm and trauma? It's a hard thing to do.
Thanks for going on. This has been
appreciate it, mate.
Really powerful.
Yeah, appreciate it.